Please be seated. I heard an applause. You can put your hands together for the Ghana National Anthem. Usually when this is played, it means we are ready to give Nigeria a good whipping in football. But because Baba is here, we will behave. Would like to first acknowledge the host and president of the Republic of Ghana, Excellency John Dramani Mahama. Welcome, sir. Please put your hands together for the president. We are privileged to have the former president of the Federal Republic of Nigeria, Excellency Olusegun Obasanjo, here with us. Thank you, sir. We are so grateful to have the former president of Liberia, Her Excellency Ellen Johnson Sirleaf, here with us. Thank you, ma'am. Extremely happy to have the former president of the Republic of Mauritius, Excellency Amina Gurib Fakim, also here with us. It's also a distinct honor to have the DG of the WHO, Dr. Tedros Ghebreyesus, here with us in Ghana. We have a whole raft of health ministers here. We would acknowledge all of them, but just for the purpose of protocol, I'd like to acknowledge, of course, the Minister of Health for Ghana, the host country, the Honorable Kobna Minta Akando. And of course, our cousin, the Honorable Professor Mohammed Ali Pat, Coordinating Minister of Health and Social Welfare for Nigeria. You are officially welcome to the Accra Health Sovereignty Summit, dubbed the Accra Initiative, happening today in the capital of Ghana, which is the gateway to Africa. When we say that, usually some people say Ghana is the gateway, we are the final destination. But there are three key words for today's program. We are here to reimagine healthcare, to co-create solutions for our future, and to insist on health sovereignty. This program comprises three parts, where we would have the official launch, which is where we are at. We would also have deliberate high-level dialogues, reflections, and collective action planning. And in the spirit of co-creation, even though I am the MC for the first part, I have a co-moderator in the person of the excellent Dr. Magda Robalo, who is a global health expert and the former Minister of Health for Guinea-Bissau. Let's acknowledge her with a round of applause. She will lead us through the heavy lifting. We'd like to make two quick announcements that for the exigency of the moment, this is a very different summit. There will be no coffee or cocoa breaks, but there is a lot of cocoa drinks in the lobby. We want to make the best use of time, and therefore you can go out and get drinks as and when you need it. The second announcement is that this program is being simultaneously cast in French, Portuguese, and English. And we've assisted with those facilities next to you so you can hear the language that best suits you. We'd like to set the scene by bringing upstage the newly appointed. He's new because although he's been in Parliament for 12 years and he's been a ranking member of health for 7, he's been a Minister of Health for less than a year. His Excellency asked him to put his money where his mouth is, because as ranking member, he was doing a lot of advocacy in opposition. So now his job is to perform, to deliver quality health care to the people of Ghana. Ladies and gentlemen, help me welcome the Minister of Health for Ghana, the Honorable Kobna Minta Akando, to set the scene for the Africa Health Sovereignty Summit.
Thank you, Bernard. Your Excellency President John Dramani Mahama, the President of the Republic of Ghana, Your Excellencies President Obasanjo, Your Excellency Johnson Sirleaf, Your Excellency Amina Gurib Fakim, the Director General WHO, Dr. Tedros, distinguished ministers, partners, friends of Africa. On behalf of government and the people of Ghana, I warmly welcome you all to Accra. We gather today at a moment of both extraordinary urgency and possibility. Ladies and gentlemen, I see before me the faces of those who bear the heaviest responsibility in the modern Africa state to protect life. This summit is not about repeating old resolutions and polishing familiar declarations. It is about reimagining a future where Africa owns its health, where the well-being of our people depends not on goodwill from afar, but on wisdom, solidarity, and investment from within. As you might have realized, we no longer speak of compact, a fist-closed agreement. Now we speak of an initiative, a living, evolving commitment that breathes and dares, inviting us to work together step by step, uttering our own story and shaping the future on our own terms. Your Excellencies, distinguished guests, the shift reflects clear feedback we received from governments, partners, and communities across the continent that called for a more flexible, inclusive, and dynamic approach to healthcare sovereignty. What do we mean by health sovereignty? We do not mean isolation. We mean the power to make binding decisions, to deploy our own resources, and to lead the systems that determine whether our people live or die. For too long, Africa has been spoken to rather than to listen to. Our health budgets and policies were shaped more by donor ceilings than by public need. Much of this architecture was designed in crisis, and crisis often freezes systems that should evolve. As an African proverb teaches us, he who has health has hope, and he who has hope has everything. Health is a precondition for every liberty we cherish: education, employment, equity, even peace. A dependent health system cannot defend itself, and a sick nation cannot develop. This is why we must shift the paradigm. Health should not be an afterthought. It should not be funded by charity after other more important sectors are handled. As Dr. Ngozi Okonjo-Iweala rightly said, health is development itself. Ladies and gentlemen, in Ghana, we have walked this path with resolve. Our national health insurance scheme, our community-based chiefs compound, and investment in local pharmaceutical production are not perfect, but they declare a powerful truth. African problems demand African solutions. Let us recall Africa's leadership in global health. From Ama Ata primary healthcare vision to Abuja's commitment for at least 15% of national budget for health, and more recently, the Lusaka agenda. The question now is, how have we kept this promise? And if not, what holds us back? Dear leaders, sovereignty begins with honesty, the courage to measure ourselves against our own standards. Ladies and gentlemen, health sovereignty does not mean rejecting partnership. It means demanding mutual respect and equal footing. We present not only in the waiting room, but in the operating theater, designing, leading, and owning our health future. It means investing in strong data systems so our realities are truly reflected. It means supply chain sovereignty. Above all, it means a political courage to fund health even when the budget is tight. This is what we mean to do, because when health is financed wisely, it always pays for itself in increased productivity, stability, and improved quality of life. Let us remind ourselves that this summit is not a mere meeting. It is a living initiative. We have a space for shared learning, open challenge, and collective ambition. It's a historical opportunity to co-create and shape the architecture of our health governance. We have the knowledge, the experience, and the wisdom in this room. Our challenge is the courage to act together. As I close, I return to the proverb that guides us. He who has health has hope, and he who has hope has everything. Let us give our continent everything it needs to hope again. We must close not with declarations, but with fierce, actionable commitments that ensure our dignity no longer depend on the generosity of others. Let us build a future where our investment, innovation, integrity secure the well-being of our children. Ladies and gentlemen, the task is immense but not impossible, because the most radical act in global health today is simple: to believe that Africa deserves better and to build accordingly. May we rise to the responsibility history has placed on us. I'm grateful for the opportunity.
Thank you very much, Honorable Minister of Health, Kwabena Minta Akando. To have health is to have hope. Let's put on one more time for that rousing clarion call for the sovereignty of Africa's health. We'd like to bring up stage now to speak to us. She started as a human rights advocate. She later became the Minister of Gender, Children and Social Protection for Ghana. Now she's the Deputy Chief of Staff. Ladies and gentlemen, please help me receive Nana Oyebampo Addo, to build on the foundation so eloquently laid by the Minister of Health. Thank you.
Your Excellency, the President of the Republic of Ghana, John Dramani Mahama, Excellency, the Director General of the WHO, Excellencies, former Presidents of Mauritius, Nigeria, and Liberia, Honorable Ministers, distinguished guests, ladies and gentlemen, once again, on behalf of His Excellency John Dramani Mahama, President of the Republic of Ghana, the people of Ghana warmly welcome you all to Accra, Akwaba. Following on from the remarks of our Honorable Minister of Health, Honorable Akando, allow me to frame this summit in the appropriate context and focus on the outcomes that bring us together today. Your Excellencies, ladies and gentlemen, we converge in Accra at a critical moment for global health. Our hard-won gains are at risk, from maternal and child health to HIV and pandemic responses. Additionally, shifting geopolitics and reduced donor funding are testing the resilience of our systems. The global health governance architecture, built in a different era, no longer reflects Africa's realities of this time. It is no longer fit for purpose. This high-level summit is our response. It is a call to reimagine health governance through African leadership and continental sovereignty. This summit is not a ceremonial meeting. It is a working co-creation. Lay the foundation for a presidential task force to design a time-bound, actionable framework for reforming global health governance in line with our national and continental priorities. We are also seeking to reflect on the changing global health landscape and its impact on Africa, both the risks and opportunities before us. We also seek to co-create bold, sovereign solutions that will influence a reimagined global health governance architecture with Africa as its center. We will endorse a sustained framework. This will be our vehicle for safeguarding health gains, driving country-led reforms, and preparing our systems for the future. We will define a clear roadmap beyond Accra, ensuring that the solutions we design here are socialized and adopted through key African and global milestones. From the African Union summits to the United Nations General Assembly and other global health fora, so that our collective voice is heard and acted upon. These outcomes are not just words on paper. They are the roadmap for delivery, from Rome to national capitals, and from our continent to the global stage. This summit is also a signal to the world that Africa is no longer a passive participant in global health governance, that we are authors of the reforms we need. We are investors on our own systems, and we are partners to the world on equal terms. By working together today, we are launching an Africa-led initiative that can reshape not only our continental approach, but also the global health order. We are going to make it more inclusive, more resilient, and more reflective of today's realities. So this is a call to action. Excellencies, ladies and gentlemen, on behalf of His Excellency President John Dramani Mahama, I thank you all for joining us and for your commitment to building a new era of health sovereignty. Let us leave Accra with bold outcomes, actionable next steps, and a shared determination to protect the health, sovereignty, and dignity of our people. And let us carry this work forward to every milestone, from every AU meeting and also the United Nations. Let's carry this forward until these solutions are fully embraced and fully implemented. Thank you.
Oh, come on. I think she deserves a better round of applause than that. Thank you, Nana Oye Litha, for reminding us that what happens in Accra will not stay in Accra. It will reverberate across the globe, to the extent that partners from all over the world would solidarize with us in this noble journey towards health sovereignty. Let's applaud her one more time. Thank you so much. In the spirit of partnership and collaboration, we'd like to now hear from an important global leader and a champion of health sovereignty in the world. He is the former Prime Minister of the United Kingdom. The Right Honorable Gordon Brown will join us by video link. Please pay attention to the screen.
I want to express profound gratitude to His Excellency President Mahama and all African heads of state and government who are convening this important Health Africa Sovereignty Summit to formulate the Accra Compact. And while I can't be with you in person and I'm with you only online, I feel very close to your ambitions and ideals and want to support your initiatives in any way I can to progress this new, innovative and very exciting health agenda. You know, while the old order of solidarity and multilateralism has achieved much in reducing infant and maternal mortality, vaccinating millions of children, attacking polio, TB, malaria, HIV, AIDS and many diseases, all the pillars on which this world order was built are crumbling. We're moving from a unipolar world to a multipolar one, to one which has got to recognise, as I've argued for years, the rising aspirations of the Global South in all our international institutions, and to an order where, despite growing protectionism, global problems from climate change and financial contagion to inequality and pandemics that need global solutions require us to cooperate more closely together as partners. So we need a new world order that meets the ambitions of the South, engages all parts of the world as partners, and ensures a sustainable, vibrant, secure and prosperous future. And as in the past, health can serve as the cutting edge of the transformation required. But you know too, we're also at a point of crisis, with the steady 40% reduction in ODA over the past 5 years, now combined with a rapid acceleration in decline over the past 8 months. Global health as we once knew it is no more. I believe that even out of this setback, however, we can shape a better, more healthy future. Because I agree with the leaders from low and middle income countries who are now speaking out, not just against the reduction in promised provision of aid, but against the very system of dependency that failed in the end to deliver sustainable domestic health systems of the kind we need. And they are calling for us, as I call for us, to reimagine the future of global health, to build a new architecture informed by country-led and regionally led transition plans, to move from aid dependency to independent, locally linked development. And such architecture, as you have said, needs to draw on pioneering models of country-led transitions away from external health ownership and financing and towards self-reliance through capacity building. And that will take into account the need for local ownership of data, and will take into account new forces like the risk of displacement and illness because of the effect of climate change. Crucially, this new model would shift the emphasis of health policy from outsiders managing the delivery of services and driving policy to local providers running them, giving precedence to what should have always been the case, the local delivery of local solutions, health run by the people for the people, the outcomes dictated by people on the ground. Now, I know that this important transition, which you are pushing forward with in your proceedings today, will also require increased funding. In each of your countries, you will chart your own course, but I will stress to my counterparts in the North that we have a responsibility to help fund this transition. And here there is great potential from innovative approaches, such as guarantees provided by high-income countries. But as you know as well, there are taxes locally. On tobaccos, we tax tobacco at 80% in the United Kingdom. Alcohol, we tax at 70%, as well as taxes on sugary beverages, with the dual benefit of raising revenue while curbing use of products harmful to health and costly for health budgets. So you who are assembled in Accra can be the leaders of this transformation, supporting countries to successfully transition from external dependence to a new engagement founded in full country ownership and leadership, with new partnerships to support a holistic, all of government, all of society approach to development, and to embrace this new compact, the Accra Compact, to create a better future for all of us. I applaud President Mahama's and the other African leaders who are grasping the mantle and working to drive global change. I assure you of my strong support and commitment to persuade others in this continent to be part of the worldwide movement you have begun today, and to do so in whatever ways we can to back your efforts. My best wishes in everything you do.
We thank the Right Honorable Gordon Brown for recognizing Africa's central role in the future of global health. We now like to bring up a man we're very proud of here in Ghana, because we saw how ably he led the world during the dark days of COVID-19. And from those days, he hasn't looked back. We're very proud to have Dr. Tedros Ghebreyesus, who is the DG for the World Health Organization, to bring us his remarks at the 2025 Accra Health Sovereignty Summit. Please welcome Dr. Ghebreyesus with a resounding round of applause. Thank you.
Thank you, moderator. Your Excellency, President Mahama, Excellencies, former President Obasanjo, my good friend, former President Sirleaf, former President Amina, Excellencies, dear colleagues and friends, thank you for the opportunity to join you today. And my thanks to President Mahama for his leadership in convening us to chart a new course for the health financing and governance on our continent. The summit builds on the leadership of President Kagame and the work of the Africa Union to strengthen the reliance of African nations on their own resources to finance the health of their own people. And it goes a step further, acknowledging that finance alone will not take us to the aspirations of the Lusaka Agenda for country-owned, investment-oriented, sustainable health systems. We must address the deficient global health architecture. As you all know, sudden and steep cuts to aid are now causing the most severe disruptions to health systems since the peak of the COVID-19 pandemic. According to WHO's latest analysis, health aid is projected to decline by up to 40% this year compared to just 2 years ago. This is not a gradual shift. It's a cliff edge. Life-saving medicines are sitting in warehouses. Health workers are losing jobs. Clinics are closing, and millions are missing care. We must all adjust to this new reality. But in this crisis lies an opportunity to shake off the yoke of aid dependency and embrace a new era of sovereignty, self-reliance, and solidarity. Many African leaders have told me they're ready to make that transition, as President Mahama is demonstrating. And that's the critical first step: political commitment from the highest levels. The responsibility for financing strong, resilient health systems rests with governments. The most efficient and equitable source of health financing is the national budget. Ghana is leading by example. Earlier this year, the Parliament passed reforms to increase financing for the National Health Insurance Scheme, filling the gap left by donor withdrawal and delivering on the President Mahama's bold commitment to free primary health care for all. That's what sovereignty looks like. And thank you, Mr. President. Of course, private capital and philanthropic capital are both very important, but they can only complement public financing and they cannot replace it. And more money alone is not enough. What's important is how effectively that money is used. WHO's work with countries has shown that up to 13% of health budgets in low and middle income countries go unspent due to weak public financial system. That is money lost. But more importantly, it means lives lost. WHO is now working with governments and partners here in Africa and elsewhere to strengthen value for money in several ways. By developing essential health benefit packages and cost-effective policies, by supporting countries to introduce or increase health taxes on tobacco, alcohol, and sugary drinks, through pool procurement and investment in domestic manufacturing, by integrating donor-funded vertical programs into government-led systems based on primary health care, and through public health insurance, and through better budget execution using digital public health financial management system. We must also confront the structural constraints. Debt service burdens are crowding out social investments, and donor funding often bypasses national systems, making long-term planning almost impossible. We cannot ignore the broader economic context. In 2023, Africa received $74 billion in aid, but lost $90 billion to illicit financial flows and $55 billion to corporate tax exemptions. So Africa lost much more than it gained from aid. And this is unacceptable. One practical solution is health taxes. A 50% price increase on harmful products like tobacco, alcohol, and sugary drinks could generate an additional $3.7 trillion globally within 5 years and save millions of lives. Beyond domestic reforms, global change is essential. WHO is using its presence on global fora, from the G20 to the European Commission, the severe financing for development to the UN and the BRICS group, to call for a more democratic, fairer, and accountable global health architecture. In May, the World Health Assembly adopted a landmark resolution led by Nigeria, my brother here, Mohammed Pate, and co-sponsored by over 25 countries, including Ghana, South Africa, Senegal, and Zambia, calling for more domestic investment and deeper governance reform. It reflects the Lusaka agenda and the principles of one plan, one budget, one report. WHO's mandate is to support governments in building strong, resilient, inclusive health systems, guided by evidence and grounded in equity. Let me be clear. Africa does not need charity. Africa needs fair terms. As President Nkrumah said over 60 years ago, I quote, "We are not interested in handouts. We seek a new international order in which health and development are global rights, not privileges for the few." This is not a dream. It is a choice. The difference between crisis and opportunity is leadership. We need leadership from governments to invest in their people and their health. We need leadership from creditors to offer concessional lending at fair terms. We need leadership from donors to strengthen national health systems, not create parallel ones. Ultimately, health is not a cost to be contained. It's an investment to be nurtured in people, in stability, and in prosperity. And the leadership by President Mahama now to address these issues is very timely. Thank you, Your Excellency, and let's seize this moment not just to repair, but to transform. Thank you. Medasi.
So the response to Medasi is Enasi. And as you channeled your inner Kwame Nkrumah, we remember the red, gold, and green of Ethiopia, which inspires us here in Ghana. Thank you, Dr. Tedros, for telling us that health is not a cost to be contained, but an investment to be nurtured in people, institutions, and stability. Let's acknowledge him one more time. We're still here at the Accra Health Sovereignty Summit with our 3 watchwords. We're co-creating, we're reimagining health sovereignty. And it is with distinct pleasure now that we welcome a man who needs no introduction. I'd like to invite us to rise and welcome the former President of the Federal Republic of Nigeria, His Excellency Olusegun Obasanjo, to bring us his fatherly remarks on this auspicious day for health sovereignty on the African continent. Please keep clapping as we welcome our father. Thank you, sir.
Please be seated. President Mahama, thank you very much for laying this on. My dear sister, President Johnson Sirleaf, thank you for making it here and giving encouragement to our brother. President Amina, thank you also for being here. Tedros, I won't say president, but you never know. Thank you for being here. When we have a problem and the world health situation today is problematic, I believe it is the responsibility of leaders not to just wring their hands, but to stand up and do something about it. And President Mahama, that is what you are doing. President Mahama, that is what you are doing. I will also want to thank President Kagame, who has been spearheading African health, financing, architecture, and infrastructure. I want to thank Prime Minister Gordon Brown for giving support and going along with us on this journey. It's not going to be an easy journey, but it's a journey, if I may say, that has precedent. We have been in very critical health situation in the past. We had Ebola. We had HIV/AIDS pandemic. We had COVID-19 pandemic. But we rode out of all this. And the way we handled HIV/AIDS in particular should give us something to cheer about, something to give us hope, and something that can lead us to where we need to go in the fractured global health situation that we are in now. I don't believe that I need to belabor the situation that we are in, but I believe what we need is solution. How do we move from the present to the future, immediate future, of hope, of confidence, and of health security for all? Let me start at the family level, family and community level. I believe that we need to do more with traditional medicine. I was in a meeting not too long ago, about, 15 years ago. And the meeting was about afforestation. And when I got there, the people I started seeing were people in pharmaceutical. So I thought I was in the wrong place. When I went to them, I said, look, we are here for afforestation. Why are you here? And they said they were in for afforestation too. And they told me and said, 80% of the drugs we buy in the pharmacies have their origin in herbs. And what is happening is that these trees are being cut, they are being destroyed, and they have not extracted enough from the herbs. I learned a lesson from there. So the herbs that we have in our villages and rural areas are useful. And even the pharmaceuticals of the world have 80% of what they sell to us having their origin from herbs. At the family and community level, we can use more herbs than we are using traditional medicine. At the national level, I believe that there's virtually no country in Africa today that doesn't have health insurance in one form or the other. We can expand and enhance health insurance. And 25% of our health insurance fund can be used to manage our health architecture and go into health infrastructure. At the continental level, just as we have now risen to have a peace fund, and I tell you what that peace fund has started to do. When I was appointed Special Envoy for the Horn of Africa, and I was handling the situation in Ethiopia, AU was waiting for European money before I could start, or American money. Today, 5 of us have been appointed as facilitator for DRC and Rwanda. Immediately, AU made available $1 million out of peace fund. That is progress. I believe we can have a health fund for Africa. And this health fund can be managed by Africa Development Bank. And the source, to start with, something like $100 for flying into Africa or flying out of Africa, but not for traveling within Africa. And then, of course, we can see what else we can do to enhance that fund. But we need health fund for Africa. Global, I believe at the global level, we should have health security for all. Health security for all. Here in this country, some time ago, the slogan was Ghana Beyond Aid. I believe the slogan for us should be now Africa Health Without Aid. But with global partnership, solidarity, cooperation, and collaboration, and of course, togetherness. Because pandemic, as we have seen, knows no geographical boundary, knows no borders. We have to work separately and together for security for all, health security for all. Thank you.
Thank you, Your Excellency Olusegun Obasanjo. Let's put our hands together one more time for His Excellency. Thank you so much. From Ghana Without Aid to African Health Without Aid. Please be seated. This is still the Africa Health Sovereignty Summit coming to you from Accra, Ghana. We have heard from the doyen of Nigerian politics, Excellency Olusegun Obasanjo. We will be bringing up shortly our host and special guest. But before we do this, as has been alluded to by other speakers, this man is very committed to healthcare to the extent that he has put his name under a very important initiative of his. We went to the streets of the country to find out the expectations around that very important initiative and their hopes around that program. So before we bring up His Excellency, we would like to show you a short video documentary of what ordinary Ghanaians are saying about the expectations of the Mahama Cares program. Please pay attention to the screens.
Mahama Care is about taking the hospital to the people in such a way that when you go to the rural areas, they find it difficult getting to hospital. So Mahama Care is a good policy that I think all Ghanaians can benefit from it.
Well, I have fairly heard about the Mahama Cares, and I know it's government's efforts in supporting the healthcare industry in Ghana. I've been to the Trust Hospital, and that's where I usually go for my healthcare. The service was great. I see that they've really renovated the place. Everything was pretty smooth in terms of the infrastructure, in terms of the systems, and I didn't really waste time there at all.
So at the moment, my grandmom is at the Ridge Hospital, and she's been on admission since last week. And I think that if government invests more in that, it's a good thing, because you know you are coming to get well, not to take something back home.
The Ridge Hospital, I've been hearing, but I haven't been here. This is my first time. I think I came here 4 days ago, and I can say that the nurses and the doctors, like the attentive, they are very good. They took very care of my mom. When she came, the high pressure, she was very bad, but they took care of her, and I can say they did very well. What I came to see here, I was very impressive. The government, the nurses, the doctors, they are very good. So for my advice, he can put on, because he's helping the citizens. Okay, he's helping us too. So I'm just saying that he should also do more and do more about the healthcare.
More investment in the health center is going to help us, because some people are in emergency. If you have more hospitals, I don't think even our own politicians will be traveling to outside the country to get healthcare. So if we invest in our healthcare, I think it's something good for we Ghanaians.
I think it's really important for the government to invest in the healthcare system for the ordinary Ghanaian, because healthcare is so crucial. And as Ghanaians, if you don't have a healthy nation, you can't have a working country. So the government's efforts at ensuring that each district has a hospital or has a working clinic will help the citizens in those areas, to thrive and to prosper.
I have visited UGMC. It's top notch, honestly, from my experience, and some of my family members who have attended or have gone there for healthcare services. It's really been good so far. I don't have anything to complain about, because when it comes to the infrastructure, everything is there. There are doctors there too, and then the maintenance. Every time, the place is being well kept.
I've been to Accra Regional Hospital, Rich, and I've been there myself. When I'm ill, I reach there. I've been there myself. It's okay. Everything is all right, and I think the standard too is okay. But the only problem is the workers there. I think just 2 days, we saw the minister himself visiting some of the hospitals, unexpected, and he saw what is going on. So I think the government have to capitalize on that and have good talk with the health workers, so that they can relate to we, the citizens, so that everything will be okay for us.
So I just want to thank President John Mahama for the good work, for the Ridge Hospital, Bank of Ghana, for all the good things that he's been doing. We say when I came here, my mom is very comfortable, she hasn't complained, and me myself, I've seen the good work. So I just want to plead, we should build more and more, so that when we come, that the ones that are from the village, when they come, they can also feel more comfortable, and they say more good things about how we are saying about him. We all want to say thank you for everything that he has done.
Your Excellency, Dramani Mahama, I think that the healthcare infrastructure you've made so far is really helping a lot, and I would entreat you, with all due respect, to do more, because the population is, increasing day by day, and there are more people who need healthcare around and they are not getting. So the fact that you are even thinking about that is really a good thing, and we thank you very much as Ghanaians.
Well, Mr. President, my message to you is to ensure that, one, Ghanaians are eating healthy. Not only that, but to ensure that our hospitals are well equipped with the right equipment and tools that will support the healthcare system. That the nurses and doctors are also well equipped and well paid as well. This is really important for our healthcare system.
Great expectations from the streets of Ghana. We've heard from the citizens. Now let's hear from the man himself. Let's rise and welcome our host and special guest, His Excellency, the President of the Republic of Ghana, John Dramani Mahama. Please put your hands together.
Thank you very much. Kindly resume your seats. A few months ago, I had one of the rare weekends when I didn't have a social engagement, and so I decided to take it easy at home. And then I got a call He says, President Obasanjo is coming to see you. I said, Baba, you won't let me rest small. And so he arrived with a big retinue of people. And it had President Obasanjo, our friend Mark Daibo, Michelle Sidibe, Edem Aziogonu, and Archbishop Duncan Williams. Now this had happened just after the events in America where the US aid office was shut down and America announced a suspension of US aid programs. And so even though the issue of health sovereignty and domestic financing of our health systems had been an issue of discussion for several years, that event made it even more urgent. And so Baba had dragged all these people with him and said, we need to hold a conference and put some more urgency into creating resilient, self-sustaining and self-reliant health systems. And so that is how come the idea of this summit was born. And so President Obasanjo, Archbishop Duncan Williams, Michelle Sidibe, Mike Daibo, Edem Aziogonu, and all of you who gave birth to this idea, I want to thank you. It's because of you we're here today. I want to thank the DG of the World Health Organization for leaving everything and coming to join us. His presence lends importance and urgency to the subject that we're discussing here. And he said something. He said the difference between crisis and opportunity is leadership. And so I think that as leaders of Africa, we must take the bull by the horns and lead this conversation and ensure that we're able to build more resilient health systems. My sister Amina, who hosted me when she was president of Mauritius, I want to thank you for coming. And my mother, Johnson Sirleaf, former president of Liberia, I want to thank you also for coming. Minister Pate, all the ministers from Guinea-Bissau and other countries who have joined us today, I want to thank you. In the holding room, I was discussing with Director General Tedros, and I was talking about President Ruto having invited us to come and understudy their primary healthcare system. And it turned out that the technical assistance for setting up that system came from the World Health Organization. And so immediately, Director General Tedros offered that he would send his technical team to come and work with our Ministry of Health to set up our own primary healthcare system. So I want to thank you in advance. There's a story of my father's friend who went to a friend to borrow his car. And he went to ask him to buy him a car. And when he went with goats and sheep and guinea fowls and came and said, I came to thank you in advance for the car that you have agreed to buy me. So DG Tedros, in African tradition, I've thanked you. And so we'll expect your technical team to come and work with us to design our own primary healthcare system. I believe that this would help with preventive health system and create a more resilient health system for us. So I want to thank you, all of you who have taken time, Victor Bampo, Nanoye Bampo, and all of you who have made this possible. I want to thank all of you and all those who have traveled from near and far to join us. Thank you very much. So without wasting any more time, Your Excellencies, let me begin by offering you a heartfelt akwaba, and that is a warm welcome to Ghana, the land of freedom and justice, and the proud home of Pan-African aspirations. We're not gathered here today by chance. We're here by conviction, shared purpose, and a collective refusal to accept the limits imposed on us by an outdated global health order. We're here because we choose to lead reform, to heal, and reimagine what our healthcare systems can be. This summit comes at a time of overlapping and intensifying global crises. We have wars, we have pandemics, we have climate shocks, we have economic volatility and widening inequalities. And these are not just testing our systems, indeed they are exposing where the fault lines are. The world has changed, but global health governance has not kept pace with the changing world. At this moment, we're called to redesign the architecture that has for far too long excluded Africa's voices, excluded Africa's needs and innovations. We're called to build systems that do more than respond to crisis. We must build systems that generate resilience, produce equity, and amplify dignity of our people. Let me be clear. We've seen profound global health achievements over the past decades. That is true. And let us honor those successes. For instance, child mortality has been halved since the 1990s. Maternal deaths have dropped by over 40% since the year 2000. Over 29 million people now have access to life-saving antiretroviral treatments. Millions are living longer and healthier lives due to cleaner air, better sanitation, and innovative health systems. These gains have not been by accident. They've been the fruits of bold partnerships like Gavi, the Alliance for Vaccination, the Global Fund, PEPFAR, unfortunately, that's part of the program that has been cancelled under USAID, and many others. But even as we celebrate, we must confront the truth. These gains are now under siege. In 2023, global development assistance declined sharply, and Africa felt the shock. Immediately, maternal health programs halted, vaccine supplies delayed, and medicines disappeared from the clinical shelves. In Ghana, our community-based health delivery model, which we call the CHIPS compound programs, was brought to its knees by abrupt funding withdrawals. The ripple effects were felt all across our country, from Dodowa to Damango. This is not merely a funding gap, it is a crisis of imagination, a vacuum of solidarity, and a deep failure of shared responsibility. Above all, it is a question of the sovereignty, the right of African nations to determine their health priorities, marshal their capacities, and lead with their own vision. And so out of adversity comes opportunity. Africa must no longer be the patient. It must be the driver. It must be the author. It must be the architect and the advocate of its own health destiny. Let us remember that Africa is not new to global health leadership. When HIV and AIDS ravaged our continent, African leaders like President Olusegun Obasanjo and the late Kofi Annan of blessed memory helped catalyze global responses that birthed the Global Fund and Gavi. When Ebola struck West Africa, President Ellen Johnson Sirleaf and her colleagues became a moral compass for the conscience of the continent. During COVID-19, President Cyril Ramaphosa rallied the African Union into collective action on vaccine access. Today, President William Ruto is leading the charge to eliminate malaria as a continental scourge. Today, President Kagame is the African champion on domestic health financing and is leading advocacy in building resilient, self-reliant African health systems. We've built enduring institutions like CDC, Panabios, the African Medicine Agency, that are not merely bureaucracies. These are symbols of an emerging African health ecosystem that is rooted in digital innovation, it is grounded in data, and designed for self-determination by African countries. Your Excellencies, ladies and gentlemen, here in Ghana, we have not stood still. We have uncapped our National Health Insurance Scheme financing, opening a fiscal space of about 3.5 billion cedis more for broader and deeper health coverage. We've launched the Ghana Medical Trust Fund, otherwise called Mahama Cares, a sovereign innovation mobilizing public, private, and philanthropic capital to tackle chronic disease burdens like hypertension, diabetes, and kidney failure. Our launch of our primary health care program in the coming months, along with the recruitment of community health volunteers, will improve the general health and wellness of our citizens, marking a significant step forward in preventive care. And that is where DG Tedros has promised to help us. But let me share one real-life story. And this is of Akosua, a young mother in a town just not too far from Accra, called Dodowa. She survived childbirth complications because the CHIPS compound she attends was digitally linked to a regional hospital. And so in real time, she had a real-time referral system that saved her life in childbirth despite the complication. A digital prescription platform ensured that she received the medicines that she needed without delay. This is not a vision of the future. It is present reality of health sovereignty in Ghana. We are not merely reacting to emergencies, we are building systems that create jobs, reduce inequalities, and uphold the dignity of every Ghanaian, no matter where they are. Health is wealth, and we must reframe the economics of well-being. We must reject the outdated notion that health drains our economies. In truth, health is the engine of productivity and bedrock of inclusive growth. The WHO has shown that for every $1 invested in health resilience, it yields up to $4 in returns. This return is even greater in Africa, where youthful populations represent latent economic dynamism. And so every malaria case that is prevented is a day of work that you have regained. Every maternal death that is avoided is a family that continues to remain stable. Every vaccinated child is a future you have secured for your nation. We must therefore urge our ministers of finance, and I'm sad our Minister of Finance is not here, to treat health as a capital investment, to encourage sovereign wealth funds to allocate resources to biotech, to diagnostics, and resilient infrastructure, to call on economists to revise national accounts to reflect health as productivity multiplier and not a consumption expense. And so I suggest that we act decisively at 3 levels. And the first one is that globally we must champion a new health governance architecture that reflects a multipolar, digitally interconnected, climate-challenged world. Health governance must be democratic, it must be just, and it must be fit for the 21st century realities. The second one is that regionally Africa must scale up its homegrown solutions. The Africa CDC, the African Medicine Agency, the African Continental Free Trade Area Health Corridors, and the AUDA NEPAD Resilience Agenda. These are all things that we need to scale up. And then nationally, we must execute not merely plans. This requires political will, domestic resource mobilization, and as DG Tedros said, effective leadership. So success is going to depend on our scaling innovations like PanaBios for digital health verification and pandemic preparedness, Proper for transparent medical supply chains, and BioNovac to transform vaccine production from molecules to the market. And what are the new commitments? Today I'm pleased to announce 2 significant commitments. The first is the Presidential High-Level Task Force on Global Health Governance. This will be a convening platform to engage global and continental partners to redesign the health governance systems for the world we live in now, not the world of yesterday. The second will be the launch of the Sustain Initiative, and this means scaling up sovereign transitions and institutional networks. This is a bold African-led platform that will align our national budgets with our health priorities, will mobilize sovereign, diaspora, and philanthropic capital into our health systems. It will foster cross-border learning, innovation, and accountability. And I extend an open invitation to all nations represented here to join us in building an African health investment ecosystem that is driven by purpose and is powered by equity and anchored in our sovereignty. And so, to conclude, the Accra Declaration for Health Sovereignty that we are discussing in this summit is more than a policy forum. It is a moral call to action. It is a strategic milestone and a continent-wide awakening. And I wish to thank all those who have stood with us in this journey: the Afro Champions, the African Union, the Rockefeller Foundation, the Georgetown University, the Obasanjo Foundation. Your partnership reflects the new multilateralism the world needs, grounded in co-creation, not extraction, and based on mutual respect for each other and not charity. In a world where floods erase borders and disease do not need passports, we must remember one truth: that in the face of suffering, we are all human. In the face of suffering, titles disappear. There are no doctors, there are no watchmen. What remains is our human dignity. What remains is our solidarity and our shared resolve to protect life. Health is not a luxury. It is the foundation of our freedom. It is the currency of our dignity, and it is our greatest public good. And so let the world hear this from Accra. Africa's pain is not a deficit. It is a death of perspective. Africa's healing is not a plea. It is a rallying cry for sovereignty. Our sovereignty is not isolation. It is co-creation. And so together, what should we do? Let us reset the moral compass of global health. Let us build systems that generate wealth, uphold dignity, and expand purpose. And let us not only reimagine our future, let us own it. And let us make our systems more resilient and self-reliant. And so I thank all of you who have come to join us. And from Accra, we say, let Africa rise and take advantage of the opportunities available. I thank you, and God bless us all.
Excellency John Dramani Mahama, the President of Ghana and host of the Africa Health Sovereignty Summit. Please put your hands together one more time. A new health finance architecture, homegrown solutions, effective leadership. The time to act is now, and the place to begin is here. Your Excellency, we hear you. Thank you so much for that clarion call. And we, the people of Africa, will take up the charge. We'd like to thank all our speakers, dignitaries, and partners for setting the tone for the next phase. We are closing the opening ceremony, but we're opening the discussion portal. I'd like to invite upstage Dr. Rabalo to help me, because after the national anthem and the excellencies leave us, we'll be jumping straight into a working session. Fantastic panels to be moderated by this icon of African health and the former Minister for Health for Guinea-Bissau. They want to hear you. Say hello to them.
Good morning, Your Excellencies, distinguished leaders, all participants in this very great initiative today. I'm delighted to be back in Ghana, Accra. I was here and I could testify the leadership of President Mahama during the Ebola outbreak when I was the head of WHO country office here. So as I take over from Bernard, I look forward to your bold initiatives, your bold ideas. We are here to speak frankly, candidly. Nothing is going to be prevented to come from your mouth. We want together to shape the future for global health. Thank you.
Thank you, Dr. Obalo. So we'll be in their hands right after His Excellency and dignitaries leave us. We'd like to respectfully ask us to rise for the Ghana National Anthem. after which His Excellency and his guests will leave us. We would remain in this room for the next session, which starts immediately after they leave. Please remain standing. We'll remain standing as His Excellency, the President of Ghana, Excellency Olusegun Obasanjo, former President of Liberia, former President of Mauritius, will leave us. Dr. Hebreyesus will join the delegation, Minister of Health as well. The rest of us will remain in here because the discussions will be happening in the next few moments. We will be leaving you with a few short videos to set the scene. We have some very insightful panels coming up shortly. So please remain in here. There are stands for coffee and cocoa and tea. We will not take an official break, but you can help yourself as the program proceeds. We will have a 5-minute interregnum so we can reconfigure the stage. We thank all of you for being part of the Africa Health Sovereignty Summit opening ceremony. And I will be leaving you in the able hands of your own colleague, Dr. Rabalu. Video team, thank you.
This is now officially a pandemic. The World Health Organization confirmed today
that COVID-19 can be characterized as a pandemic.
March 11th, 2020, the day a reeling world was ground to a halt. The World Health Organization declared COVID-19 a global pandemic. The world watched in horror as highly resourced health systems capitulated in terror in the face of a vicious virus. Africa's fate hanged in a balance. The continent's leadership did not fold, they did not buckle, they did not fail. Weeks before the official declaration of the pandemic, the African Union announced a joint strategy to deal with the menace. Beyond solidarity, beyond Ubuntu, beyond the courage of leadership and the foresight of hope, Africa was blessed with one more resource: a dynamic community of innovators at home with the new languages of digital technology and creative partnerships. As the continent ramped up testing facilities and quarantine centers, the African Union, through its frontline agency, the Africa CDC, was also quietly assembling its digital warriors. Supported in no small measure by its strategic partners, Afro Champions, ARSO, ASLM, Cold Chain, African Tourism Board, and a host of others. Panabios was born from this rich medium of collaboration, setting the stage for the Africa Union's trusted travel, trusted testing, and trusted vaccines systems.
Hello.
The interlocking effects of all this creativity.
May I kindly request you to take your seats? May I kindly request you to take your seats, ladies and gentlemen? Ladies and gentlemen, you are kindly requested to take your seats. We are about to start. May I kindly ask you to take your seats? Ladies and gentlemen, kindly take your seats. Thank you. Thank you. Your Excellencies, Honorable Ministers, Deputy Ministers, distinguished leaders, colleagues and friends, ladies and gentlemen. I would like to invite you for the final time to please take your seats. I want to add my voice to those who preceded me to wish you a warm welcome to Accra. And I'm rejoicing to being back in Accra, where I had the opportunity to serve in my previous professional life and could experience firsthand the leadership of President Mahama as he dealt with the Ebola outbreak that ravaged West Africa in 2014. It is my great honor and privilege to be working with Bernard in managing this important meeting today and moderating this session of our conversation, our journey to co-create the Africa we want, the Africa health sovereignty that we want for our continent. Welcome back, President Ellen Johnson Sirleaf. We are happy to have you with us. This first session will set the stage for our conversation today. It is a session where we will challenge ourselves, where we will be bold, courageous, and ambitious as we define the road we will travel to navigate the roadblocks, harness the opportunities at our disposal, and co-create the ones we need to achieve universal health coverage for our people. Millions of Africans have no access to basic health services. Too many mothers are dying while giving birth, and millions are impoverished or have to forego other critical needs for having to pay for health care. This morning, we heard our leaders declare that Africa's health future must be owned, it must be financed, and it must be governed by Africa. The Africa-led HIV Control Working Group, which I'm proud to co-lead, has been shaping the same agenda for HIV, and we could not be happier to join this exercise in a much bigger scale. Our task now is to turn this strategic vision into policy and institutional pathways that aim for equity, inclusiveness, and responsiveness. The global health architecture and its governance mechanisms are outdated and no longer serve its purpose. The global health ecosystem is under pressure like never before. Shifts in the US and other donors' financing and foreign assistance have reshaped the global landscape, signaling a more selective, politically driven, unpredictable, and volatile aid environment in a rapid pace of change, with decreased support for international cooperation and severe threats to multilateralism. Nearly all major global health initiatives are in replenishment cycles: Gavi, Global Fund, Pandemic Fund. This reflects both continued need and uncertainty about sustainable financing flows. The ecosystem itself is undergoing structural change with rising financial pressures, competing global crises, and the need to do more with fewer and less predictable resources. We are losing critical human capital. The people who design, deliver, and sustain health systems are being drawn away by better opportunities abroad. Africa must reclaim its talent and expertise to achieve true sovereignty. Africa must renegotiate trade terms, lending conditions, and reshape its economic and financial policy to increase health investment. The COVID-19 pandemic exposed our dependence, the fragility of our fragmented systems, and the human and economic costs of reactive and nationalistic global governance. If we don't reimagine and rebuild this architecture to dismantle the power imbalances and the inequities in which it is built, and rooted in country and continental sovereignty, we will remain vulnerable to perpetual cycles of dependency and external shocks. The future of global health starts in our countries, in our communities, and is dependent on how well we foster and accelerate our economic growth and redistribute the benefits to our people. We need to eliminate fragmentation and assert our priorities in collaboration with the civil society and the private sector. The reform of the global health architecture is not an if question, but a how question. And Africa is part of the how, with the purpose and the power of a collective voice to correct current patterns through systemic change that ensures equitable access to quality health services and equitable health outcomes for all, particularly the most vulnerable. Sustainability and self-reliance are courageous political choices. Sustainability in particular is fundamentally political. It demands domestic financing, integrated institutions, and leaders who make health a non-negotiable priority. Self-reliance, it was repeated here, it's not isolation. It does not mean isolation. But it means owning the agenda, negotiating with global partners as equals, and ensuring solutions are designed for African realities and needs by the African leadership. Countries like Ghana, Rwanda, Nigeria are already showing that with the right reforms and political will, dependency can be reduced and eliminated. But to increase scale and scope, we will need courage, coordination, and continental commitment. It will take purpose-driven leadership. There are critical building blocks that we need to consider if we are going to make a shift in the right direction. Number one, domestic resource mobilization, blended financing to secure systems against volatility and investment in the right priorities. Number two, institutional resilience, integrating vertical programs into country-owned accountable structures. Number three, reclaiming and empowering African talent so that the people who deliver health lead the systems that are accountable. 70% of the people who deliver healthcare are women, but only 25% of them lead the systems they know and manage. Women are also the face of poverty, the face of HIV, the face of social injustice and economic inequality. We need to rebuild with the demographic realities in mind. Political courage to prioritize health sovereignty and financing is an economic imperative. We need a global health architecture that does not create winners and losers within countries and across countries. Global governance is shaped by a variety of actors, institutions, and processes, and Africa has decided to be at the center of it. To conclude, I want to challenge you all, the panelists and the audience, with one central question. What will it take to truly reimagine the global health architecture and root it in country and continental sovereignty? I invite us all to use this session to think boldly, speak candidly, and design solutions that will outlive this summit. Africa must be remembered as the moment Africa chose to lead its health future by design, not by default, building on the work done by others and in other places. So, ladies and gentlemen, with this short notes to introduce our session, I would like to now invite our distinguished Honorable Coordinating Minister for Health from Nigeria, Professor Muhammad Pate, to share with us his reflections on what we need to do to build Africa health sovereignty.
Thank you, Magda. Your Excellencies, our former heads of state, Baba, former President Olusegun Obasanjo, our mother, former President Salif Johnson, former President Amina Fakim, my colleagues, honorable ministers, distinguished members of this forum. It is really a great honor that my colleague and I, Minister of Foreign Affairs in the Federal Republic of Nigeria, Minister of State, Bianca Ojukwu, and myself are here on behalf of President Bola Ahmed Tinubu, GCFR, who was unable to be at this summit, despite all the intentions to be part of this conversation. Excellencies, it is indeed a great honor for us to be invited for a conversation among African leaders and close friends of Africa to reimagine global health governance, consider new multilateral arrangements and health financing approaches as we all call for a new global health order. I draw on some of the work that we have done over the last several years in the Future of Health and Economic Resiliency Commission, which I had the privilege of co-chairing with Minister Awa Kolsek of Senegal and many colleagues from all over the continent who have been thinking about this effort, including the Rockefeller Foundation. That this summit is holding in Accra, Ghana, is quite fitting. For Ghana, as the President said, is the birthplace of Pan-Africanism. And we are being hosted also by a fitting successor to the father of Pan-Africanism, the late President Kwame Nkrumah. And we appreciate His Excellency President John Dramani Mahama, President and Commander-in-Chief of the Republic of Ghana, for his incredible leadership in convening this effort. With this convening, we are continuing the journey of our forebearers, whose vision, courage, and sacrifices must not be left to languish. Clearly, declining traditional donor interest in global health has precipitated the need to rethink global governance and the whole global ecosystem, like Magda shared with us. This, after appreciating the tremendous financial and technical support to poorer countries from the people and governments of the wealthier nations, the United States, Europe, United Kingdom, and several others. This has contributed to significant reductions in child mortality, expanded access to life-saving interventions, reversed key infectious diseases like HIV, TB, and malaria. Thank you, President Obasanjo. Expanded access to immunization, and now almost on the verge of polio eradication. Yet, half the world's population still have no access to basic health care. Endemic diseases, rising antimicrobial resistance, new and re-emergent diseases, non-communicable diseases, and several other problems are raising significant challenges that no longer have obvious answers. Global health, until recently, represents around almost 50 billion or more US dollars annually in official development assistance for health. And commonly, global health is described with reference to only a few issues, including diseases like HIV, malaria, TB, or with references to processes or focus areas, including health financing, human resources for health, or maternal and child health. Most of how we address these issues have been influenced by limited perspectives. The lens of others, our perspectives, African perspectives, contributions, especially in the poorer countries, have been much less acknowledged or made relevant. For example, much of the progress in advancing health outcomes in lower income countries and low middle income countries in the last 25 years were driven by domestic financing and domestic actors in poor countries, of course with the support of our external partners. Now, as we're seeing major global shifts, the geopolitical shift, and the nationalistic politics that is disrupting global health. These shifts provide us with a natural opportunity to assess what we have and to chart a much better future ahead, one that respects each country and continent's sovereignty and self-determination. The truth is that we cannot expect to build a healthier population purely on the back of other nations' money or generosity, or without connecting global with our local needs. There's no doubt that some of the stated goals of global health are positive and expansive. Yet, we also know that there are several imperfections and course corrections are necessary. And to chart a way forward, we need to understand the legacies upon which the global health system was built. One that is clearly positive and another one that is less so. The positive legacy evolved in response to the 19th century pandemics spread by globalization of commercial and military activities that led to a series of sanitary conferences at which countries agreed to collaborate in the fight against infectious diseases, working together. The reasons for such collaborations have endured, essentially unchanged for the last 200 years. First, the many ties between nations create collective health risks that are difficult to manage independently. And secondly, sharing knowledge and experience accelerates learning and facilitates rapid progress. Thirdly, agreeing on rules and standards supports the comparability of information, helps establish good practices, and underpins shared understanding and mutual trust. All these reasons drive the need for our nations to collaborate. And in the last 25 years, especially the golden era of global health, these collaborations have contributed to some of the progress that we have seen. On the less positive side of the legacy of global health, the direct ancestor of global health is tropical medicine, a field that grew directly out of colonialism and similar imperial activities, which we have to acknowledge. And the continuity between that colonial period and the immediate post-colonial period was so obvious that the Honorable Kwame Nkrumah needed only a few years to coin the term and write a book about it, Neo-Colonialism, the Last Stage of Imperialism. President Nkrumah laid particular emphasis on the economic extraction that continued and the trade imbalances and regulation that limited Ghana's choices at that time. This fact that unfair economic relationships are critical obstacles to public health has not escaped others, and many have tried in vain to address it. There were arguments that colonial trade relationships were structurally incapable of producing development and would only increase dependency by the colonies on the metropoles. Now, long before now, 70 years ago at the Bandung Conference, when the non-aligned movement was created, our countries organized to advance their collective interest. In the 70s, WHO articulated the same point in the Alma Ata Declaration by calling for a new international order, similar to what we are calling now, emphasizing global cooperation to achieve health for all. In the 90s, following intense pressure from activists, the Heavily Indebted Poor Countries Initiative was launched by the International Monetary Fund and the World Bank to address unsustainable indebtedness as another attempt to manage the sequelae of structural inequalities in the world economy. In the 2000s, the Commission on Macroeconomics and Health reached the same conclusion, calling for a new global partnership between the developed and developing countries. But despite a conclusion made severally, repeatedly over the better part of a century, most of the institutions in global health and development have not really focused significantly on the needed reforms. For global health, the consequence of these macroeconomic and trade issues is a policy space that has been constrained by several items in several ways. First, the secondary status of global health to commercial and national strategic interest discourages engagement with some of the most significant influences on health. Secondly, with the partial exception of tobacco control, global health advocates had been unable to shape the trade in commercial products. Health advocates seeking either to advance positive possibilities, such as intellectual property rights that go beyond the TRIPS agreement for patents, trademarks, and copyrights, or even limit those with harmful potential, such as ultra-processed foods, sugar-sweetened beverages, tobacco and others, have often been unsuccessful, and I am glad that Tedros highlighted that in his remarks. Third, the dependence on donor financing and their interest meant that research and project funding was focused on ever-changing priorities of specialists and advocates in the donor countries rather than responding to the real felt needs in the receiving countries. By earmarking contributions to WHO, for instance, the same donors have undermined WHO's independence, and Dr. Tedros is basically going through that. Funding priorities were set by donor nations, reducing the agency of recipient countries and limiting even WHO's independence. Plus, the resultant deindustrialization or lack of manufacturing capacity prevalent in our countries by channeling organized demands away from our local markets. And fourthly, the dominance of those macroeconomic factors enforces an intellectual ecology in which economic factors have primacy. This is seen in the high emphasis on value for money. Value for money brings a focus that challenges public priorities that do not generate easily measured economic gains, such as services for the poor, improving health systems, or even the basics like water and hygiene. In place of public health staples common to all rich countries, sanitation, hygiene, water filtration, public utilities, nutrition, housing, waste removal and management, inspection and enforcement, and the like, global health had emphasized more of other things and tools. Important issues like malaria, TB, HIV, and other specific diseases that also have, by chance, strong lobbyists, drug companies, advocates, academic specialists, and other philanthropists. The primarily disease focus does not necessarily always underlie our own ideas of health or well-being, but it does match the professional and economic interests that tend to thrive in the global health arena in some instances. These limitations are similarly evident in the global health, academic, and private sector partnerships. However, despite these limitations, we have seen some progress in the last 25 years. I had mentioned the Global Fund as a good example, the Gavi, the Vaccine Alliance, the Global Financing Facility, CEPI, Pandemic Fund, and several others. More than 70 global health partnerships. Meanwhile, now the resources are dwindling. Fragmentation has become even more of a challenge. So with this background, where do we go from here after this landmark summit? I propose a few ideas specific for African leaders and the Friends of Africa to consider towards reasserting health sovereignty for the African continent and similar other areas. I will itemize them. First, for us to think about establishing an Africa, Asia, Latin America, and the Caribbean Strategic Alliance. Considering the long-term strategic alliances which had been forged for the last 70 years or more since the Bandung conferences, forerunners to the latter Alma-Ata Declaration that birthed primary health care in 1978, African continental leadership should extend its hands to willing similar countries in other regions to form an axis for reshaping the global governance arrangements and the agenda of global health. This needs care so that we don't fall into big power politics, but it is necessary if the idea of regional sovereignty is to manifest in the face of existing huge power imbalances. Such an alliance can mandate appropriate expertise to renegotiate trade terms, including for health products, consider restorative measures for past unresolved injustices. 2, rebalance the paradigms of the cult of panacea, the things and tools, with the cult of hygiene, prevention, from disease management to health production, prevention and wellness. At the country level, ensure that investment cases are owned by national governments in partnership with our civil society and the private sector, so that recurrent cost implications of externally determined investments are accounted beforehand, and that no supranational interest subvert our national sovereignty. Third, to focus on African data sovereignty. Relevant national and continental institutions should immediately come together to assess, coordinate how Africa's standardizes, regulates and controls, protects and develops its health data infrastructure, and limits opportunities for extraction or exploitation by outside interest. For example, creating a charter on Africa health data. Fourth, to put our pocket where our mouth is, and His Excellency President Mahama said that, Africa cannot afford to outsource its most important health priorities by continued dependency. There is need to pivot towards significant increases in domestic financing mobilization, including push for renegotiated debt relief, innovative tariffs and taxes. Tedros listed them out: airlines, mining, tourism, and develop new domestic financing models. The African Development Bank and Afrexim Bank should be mandated to develop robust financial instruments and deploy them towards enhancing Africa's health. We need to explore private sector investment models and partnerships to complement the public sectors, unlock our value chains, while at the same time protecting the public mission. Fifthly, end the Geneva mission in global health. There should be no need to situate malaria, HIV, tuberculosis, or measles vaccines discussions in faraway expensive capitals that don't have that experience of these diseases. We have enough beautiful land, decent real estate, and good life from Dakar to Accra, to Abuja, to Addis, to Nairobi and Lusaka. Move all global health institutions closer to where the problems are located, whether in Mumbai, Jakarta, or Colombo, while at the same time rationalizing those institutions as they evolve away from delivering products to generating global public goods. Number 6, focus on trade in health and medical industrialization. We need ministers of trade, ministers of finance in this conversation. Develop and use the AfCFTA to accelerate intra-African trade in health commodities and services. The UN Economic Commission for Africa is well positioned to advance the idea of a continental health market with proper regulatory standards, an effective medicines regulatory agency, harmonized human resource professional regulations, facilitating movement of people and things, provide robust incentives for domestic manufacturing of test kits, drugs, biologicals, equipment, services, digital technology, etc., matched by demand-side market-shaping mechanisms, pulling the demand that we know exists in our population. Number 7, to access the state of intellectual property protection regimes in collaboration and put stronger mechanisms to protect our indigenous knowledge, our biodiversity, our innovators, and all forms of African intellectual property. This will require a robust continental mechanism that also advocates for accelerated investments in higher education, research and development. Number 8, revisit all existing biosecurity agreements with other nations to balance needs for pathogen access with commensurate benefits for African populations in times of pandemic emergencies. This includes African co-ownership of platforms and databases of pathogen genomics. And number 9, the Africa CDC, which was mentioned earlier, to strictly focus on its mandate regarding core public health functions, ensuring proper disease surveillance, outbreak and epidemic intelligence, capacity building, readiness and response coordination, and to avoid mission creep. And number 10, create a continental health army. I think Magna alluded to that, comprising our frontline health workers identified and trained to be mobilized in health emergencies as we had seen during Ebola. And number 11, to harness African knowledge systems, pursue an effort to codify our diverse sources of published and unpublished African knowledge, research outputs to be shared and acknowledged. We need to be sure that contemporary search algorithms do not discount African outputs. And finally, number 12, to harness the African diaspora systematically, whether all over the world, including the Caribbean, to deploy its skills, resources, and networks, and contextual knowledge to drive innovations and investments so that we live.
Right now, and how this is, of course, impacting the health issues. But before going into what we're going to discuss, it's going to be a very short one because I think your speech was highly comprehensive. I'd just like to ask you, that you're coming from Nigeria, just one second. What is Nigeria doing in implementing bold health reforms from financing to primary care? What key choices are driving this transformation, and what lessons can other Africans take from it?
Thank you. I think the President launched his Health Sector Renewal Investment Initiative that is focused on health outcomes, starting from looking at the governance of the health sector in a federal system, but also on the foundations, the primary health care. It's an old story, but making it happen, expanding the footprint so that we give the basic services, expand health insurance, the intersectoral determinants, the preventive efforts, alongside our subnational, our states, our local governments, in a coordinated manner, so that we invest where we reap the benefit in population health outcomes. In other words, it's what this government is doing, because we see health as key driver of human capital. It's a cost as also a consequence, and it's an investment. It's a long journey. We've started. This president is 2 years. We think that if Nigeria continues on that path, the trajectory will be different, because the outcomes that matter, responding to the needs of our citizens, reorienting and governing with the citizens at the center, I think will get us closer to that reality. And also to do that, not in isolation as Nigeria, but we see ourselves in the context of our sub-region, with our brethren here in Ghana and many other countries in the West Africa, but also in the context of the continent of Africa and with our friends globally, because it's not Africa in isolation. So we're seeing Nigeria not just going on its own, but that what we do, what we co-create, is in the context of global solidarity, regional solidarity, and also our own neighborhood.
In your keynote, you touched on something which is on the mind of many leaders and, of course, many countries across the continent. You've spoken about African data sovereignty. We know Nigeria is a powerhouse. Young people, I think 1 in 5 African is Nigerian. And you have a mass of information. How does a country like Nigeria tackle something like this?
I think this is an area where I think there's a lot of work that is needed. The backdrop of extraction, whether it's people, whether it's natural resources, whether it's research outputs, or more recently now in the contemporary world, data is resource. And as we embark on this journey of digital transformation, we have to be mindful that there's an asset in the data that we have. How do we govern it? How do you organize it? How do we control it? So in the case of Nigeria, there's a National Data Production Commission. There's a law which begins to govern who owns the data that you have, if you use it, whether it's electronic record or other forms of medical records, so that they are not, let's say, exploited for reasons that you have absolutely no access to the value. And that's a journey that no country on the continent can do it alone, and that's why it needs to be elevated at a continental level, so that we also take into account whether it's research data. Until now, there are lots of research that happens in the continent, but if you look at the publications, a large number of them are really led by folks that are outside the continent. So we are viewed as a place to go and do interesting things, to have your career, to publish, take the data, analyze, my God, even by our biodiversity and others. So we need to really think about those assets as well. What I tried to do is to think about at home, and we can harness them. That's what we're trying to do in Nigeria. Thank you.
Thank you so much, Honorable Minister. So, Excellencies and colleagues, today's reflection reminds us that Africa has the ideas, it has the talent, and she has the political will to lead its own health future. Let us carry the insights shared here into the Accra Initiative Roadmap, so that our commitment to sovereignty and delivery shapes both our continent and the global architecture. Now hand over to Dr. Magda. Thank you.
Thank you very much, Your Excellency Amina Gorib Fakin, former President of the Republic of Mauritius, and Honorable Professor Muhammad Ali Pate, Coordinating Minister of Health and Social Welfare of the Federal Republic of Nigeria, for this very insightful conversation. Thank you so much. A round of applause to them. Thank you. We are now going to move to the plenary session, where we will have the pleasure of having a conversation on reimagining a new global health governance architecture. And I would like to invite to join me here the two moderators for this session, Honorable Dr. John Kengeson, Executive Director, MasterCard Foundation, and Honorable Dr. Mike Dybel, Co-Director, Georgetown Global Health Center. Please join me on stage. Before I give the floor to Honorable Nkengeson, I would like also to invite the panelists that will have a conversation after with the two moderators. I would like to invite Ambassador Hamatu Hamoa, the AU Commissioner for Health, Humanitarian Affairs and Social Development of the African Union. Please join us on stage. I would like to invite Dr. Ebere Okereke, the Mohammed bin Zayed Foundation for Humanity Associate. Please join us.
0.5 minutes, yeah. Over to you.
Thank you very much, Ambassador John Kengeson, and I must say we are happy to have you back here. The first thing I want to say is first, and I know I have only 3 minutes, is that this is a powerful meeting, because in every conversation I've had since February, out there, out of Africa, I've been asked, where is the voice of Africa on the future of global health architecture? And this is it. So we must thank President Mahama for hosting this, and also for Ghana hosting us here. So please, let's applaud that, because now we have a voice, and we can go forward and say we have a voice on what we imagine the global health architecture should be. The next thing is, of course, I know we have a lot of partners here, John, and I must thank them, because, you know, I reflect on Kwame Nkrumah saying that, Kwame Nkrumah said he is not African because he was born in Africa. He is African because Africa was born in him. And therefore today, as we talk about Africa's sovereignty, it is asking all our partners for Africa to be born in them, so that the sovereignty that we seek is actually joint partnership. It's not either or, it's actually a joint activity for this. Now, let me just very quickly reflect on what's on my mind as I listen to this conversation about the future of the global health architecture, which is linked to the future of health and prosperity in our continent. I see sovereignty as a dual issue here, because we may focus a lot on financial sovereignty, but actually the financial sovereignty must go hand in hand with program sovereignty. So I see it as a two-way thing that we must achieve, that as we achieve financial sovereignty, it must go hand in hand with program sovereignty. And that program sovereignty, in my mind, must include climate action sovereignty, because that's the biggest threat to our health systems in the future. When you talk about financial sovereignty, as I'm listening, I'm asking myself, how do we solve the big problems of the financial challenges that Africa has? For us to achieve that financial sovereignty, we must be cognizant of the challenges that Africa itself has. If I was to take a case of Ghana and ask, what is Ghana's ability and financial ability for its sovereignty? First, program sovereignty is straightforward. We just need to have strong Africa leadership. On financial sovereignty, if I look at Ghana as an economy, I see Ghana with a GDP of about $80 billion or so, with a population of 35 million people. If I look at other countries in Europe that have a similar population set, I would look at maybe Poland and Spain. Poland has 10 times the GDP of Ghana, and Spain has 20 times the GDP of Ghana. Now, at the same time, Ghana needs to tax its people to provide health services and achieve sovereignty, but Ghana will tax at 14%, and those two other countries at 35%. What I'm trying to present here is that even as we seek financial sovereignty, we need to be cognizant that the money we have is not adequate to follow the path that we followed in the past. In which case then, program sovereignty means us redesigning our primary healthcare system, which has been talked about a lot in the morning, and which I must reflect on even Professor Pate's discussion, that we must move to health production, and the financial sovereignty and the partnerships must come together to support a health production model. We cannot afford a healthcare-driven model with the money that I've just talked about, because with what I've talked about, Ghana will do very well at $52 per capita of public money, 52.
Why do I have to go to New York, London, or Geneva to solve a problem that is actually here? Where actually the resources to solve it, the people to solve it are here. So when I'm being very troublesome, I say we need to throw the whole thing out and start again. But I recognize also that we don't always have that luxury to throw everything out. But we have got to change the status quo. We can't remain as an object in the global health discourse. We are not the architects of the governance system that we work in. We have a secondary voice, oftentimes invited to be partners in our own problems. And there's a Yoruba saying from Nigeria, which I can't say Yoruba, my language, my Yoruba is very poor, I'm Igbo. But in English, it says that you cannot shave my head in my absence. For the last 60 years, Africans have had their heads shaved repeatedly in their absence, and we need to change that narrative. So, how do we do that? I think we've talked a lot about the finance, and I acknowledge that that is important, but I think governance actually comes first. The governance, the right leadership, and we also have to accept responsibility that our leadership hasn't always stepped up. And we have representatives of our political leadership here who are now stepping up and saying we're ready to do things differently. But one of the things I care very passionately about is actually electoral representation. Our ministers are here representing the people that voted for them. But I don't know about you, I'm a bit geeky about politics. I actually collect political manifestos and check how many of them have a page on health. And unfortunately, they are very few. The last election in Nigeria that elected our current government was one of them. The government in the last elections in Ghana did, but they are not the majority. So our people actually do not know that that their elected leaders have a duty to give them access to health. And so in talking about governance, we need to actually expand the discussion beyond the technical.
Si écoutez tous les autres qui ont parlé ce matin, je suis sûr que vous êtes plein de beaucoup de réflexions. Partage avec nous tes idées, avec la discussion que vous avez suivie jusqu'à présent sur la gouvernance de la santé mondiale. Si ça ne marche pas, vous pouvez utiliser les miennes.
Merci beaucoup, Dr Kongasong. Mes respectueuses salutations à tout le monde. D'abord, je dois dire merci au président Mahama et toute son équipe, aux organisateurs de cette réunion historique de m'avoir invité à cette rencontre, qui pour moi constitue le point de départ d'une deuxième indépendance. Il n'y a pas de hasard que nous revenions ici aujourd'hui au pays de Kwame Nkrumah, le père de l'indépendance africaine, de parler aujourd'hui d'une nouvelle manière de gérer la santé en Afrique. C'est une nouvelle indépendance que nous sommes en train de proclamer. La question des structures globales de santé, c'est d'abord une question d'hommes. Ce ne sont pas les structures qui se créent. Ce sont les hommes qui les créent. Ce sont les hommes qui les gèrent. Ces structures reflètent l'état d'esprit de ces hommes. Il y a d'abord une question d'état d'esprit. Et ici, quand je parle d'état d'esprit, je vais insister sur deux choses. La première, c'est comment nous nous regardons. Comment les autres, comment on se regarde en tant qu'humain. Il y en a d'autres, il y en a certains qui se considèrent comme supérieurs à d'autres. Leurs idées sont les meilleures. La sagesse, c'est chez eux. Ainsi, donc, en Afrique, on n'a pas de sagesse. Tout est imposé. Alors que la sagesse, les populations, quand vous parlez d'une épidémie, le premier épidémiologiste, c'est la population. C'est l'individu. L'épidémie survient dans l'intimité du ménage. Si ce ménage ne le déclare pas, l'épidémie prend tout le pays. On a vu l'exemple avec l'Ebola. Il faudrait qu'on soit humble, qu'on soit humain. D'abord, c'est cette humanité qu'il faut. C'est la reconnaissance du fait qu'à travers le monde, et Covid nous l'a montré, qu'il n'y a personne qui est supérieur à l'autre. Aucun pays n'est supérieur à l'autre. Nous étions tous à genoux. On doit apprendre en tant qu'humain. On n'apprend pas. Moi, en tant que ministre de la Santé, après près de 40 ans d'exercice au pays et à l'international, je constate que on réinvente tout le temps. On n'apprend pas ni de ce qu'on fait, ni de ce que les autres font, ni des populations. Je vais donner l'exemple du Covid. Quand l'épidémie du Covid est arrivée, il y avait beaucoup de désinformation. Vous étiez au centre. Les anti-vaccins, etc. Au niveau de nos pays, on ne savait plus quoi faire. On accusait Bill Gates, on disait que c'est pour nous empoisonner, etc. On ne savait pas comment vacciner. Et nous, on a demandé, on a fait une enquête. J'ai fait une enquête dans la population pour leur demander comment ils veulent qu'on fasse pour qu'ils acceptent les vaccins. Ils ont dit dans ces enquêtes, il faut que vous, les leaders, vous vous vaccinez avant nous et nous, on va venir. C'est le seul message, la seule publicité qui a permis de vacciner tout le monde. On a écouté la population. Un autre problème, c'est la théorie de changement. Le Global Healthcare est la théorie de changement qui soutient la santé mondiale. Je ne sais pas s'il y a une théorie de changement. Quelqu'un a dit ici que si on investit $1 dans la santé, on va recueillir $4. Mais qui applique ça? Qui croit à ça? Quand je vois en tant que ministre au niveau des pays, ce sont les mécanismes de financement qui sont contre la santé. J'ai parlé avec des grands experts de Banque mondiale et de FMI qui me disent, mais quand je parle du lien, tout à l'heure, monsieur le président Mahama a parlé de l'importance de la centralité de la santé dans le développement. Mais qui y croit? Est-ce que nos structures sont faites en reflétant cette centralité de la santé? Est-ce que la FMI reconnaît la centralité de la santé? Est-ce que la Banque mondiale reconnaît la centralité de la santé? La santé comme déterminant de développement et du bien-être, mais en même temps comme produit du développement. Qui le reconnaît? Dans quelle mesure nos programmes reflètent?
So as a minister, I fight every day like a mad person because I see the fragmentation. Health is used as an instrument or a geopolitical instrument. It's instrumentalized. If you take the IMF and then World Bank, they just take part of health and then put it in a program. I mean, this is compassion. This is charity. This is not an investment in itself. we are not talking about health as a means of development. No, this is what we need to change. And I think we already spoke about the need that our approach needs to be human-centered. But let me end with a definition for resources. We are talking about financial resources. What are resources? I think the President's speech said it all. The resources are the policies, funding, the human beings, the culture, the tradition. All these constitute the resources we're talking about. If you don't take all this into consideration, there's no way we'll succeed. And this combination has not properly been taken into account. And you cannot be heard when you will not be heard when partners come to negotiate between countries. They are not listening to us. Let me end with a quote. You see, the way you give is better than what you are giving. It's not because you are giving money that everything will work. The way you are giving out that money is very important. Let me also say that the global structures need to change. And what needs to change in Africa is us. Let me take an example of Ghana. And this current summit, I will say this is a testimony that is giving me reassurance, because we need to think, we need to change. We should be able to say no and say that African governments say no. If the money is not for the needed purpose, we should say no. And secondly, African countries should believe in their own health, take their own health into their own hand. The Ministry of Health, they need to believe in health. I believe the President here called on the Minister of Finance, tell him that he is doing a good job. I think we need to be serious with ourselves for people to believe in us. So that change we are calling for. This change needs to happen at every level, because we are all part of this global architecture, be it at the national level, regional level, or at the local level, even international level. So the change needs to happen at every level. But the country is the bedrock on which that change, that global action will happen. Thank you very much. Thank you very much. You spoke about a lot, state of mind, humility, and also the theory of change. And you also spoke about resources, also the way we give. I really appreciate the last point. Thank you very much for these 5 points that you've given us.
Daibo, please lead us through the commissioner, and then you turn to the reflection. We have, I think, 3 people. Dr. Alakaji is online, and we have 2 present here. Over to you.
Your Excellency, you've had many distinguished roles, and you're currently the Commissioner at the African Union. And of course, the role of the African Union is central to translating and turning country priorities into continental priorities and action. So how, from your perspective, can AU leadership drive the continental efforts that ultimately influence change in the global sphere for health governance?
Thank you, Mark. Is it working? Okay. First of all, I'm happy that we are having this critical, timely, and vital conversation. As a continent, we know what to do. We've been talking about health financing, etc., but it's been disjointed. And this convening is a very important beginning for us. And I believe that is not going to end here. Going forward, we'll be able to bring all the 55 member states of the African Union together to have this conversation so that we can speak with one voice and then we can make progress. We've had a lot of conversation around this, and everything that we've heard here this morning points to the fact that Africa's health future is in our hands, and that we as Africans should lead it, of course, with the support of our partners, and then it should be also globally respected. The question that you're asking, how AU leadership can translate country priorities into global influence, speaks to the essence of sovereignty. Now we're talking about political sovereignty as well as sovereignty over systems, financing and solutions. And to respond to it, I'm going to offer 3 reflections. The first one is from national priorities to continental platforms. What the African Union does not replace national ambition. The African Union coordinates and amplifies it. So it's very important for us at the African Union to work with member states. From the Abuja Declaration's target of 15% investment in health on the continent by every member state, to the African Health Strategy, which is from 2016 to 2030, and now that's the Accra Compact. We have codified member states' priorities into continental mandates. And we believe that these are not aspirations. They are blueprints for integration, for investment, and for continental mandate, and also for accountability. So at the African Union, we are institutionalizing a coordinated African-owned and future-facing system through, of course, the Africa CDC, the African Medicines Agency, and then the Africa Humanitarian Agency, which is soon going to be operationalized. We believe that with these architectures, it gives us a higher purpose, which is continental leverage, which we need to communicate with the global scene. We shift from fragmented demand to collective bargaining power when we aggregate procurement, harmonize regulation, and synchronize policies. And I believe we've heard all that this morning. It's very important that we do it. If we do that, that is when Africa's voice begins to shape global systems, not merely react to them. We have to be a major part of the conversation going forward. Now, the second reflection will be on rebalancing the global governance equation. The African Union is not only about structure, but also about reframing global health governance. COVID-19, which has been mentioned here again, revealed the brutal consequences of exclusion, delayed access to vaccines and diagnostics, disrupted supply chains, and regional institutions that were overlooked rather than supported. These are not market failures, they were governance failures. That is why the African Union has stepped forward as a convener and a co-architect of global reform. We are advancing a new compact, which is based on sovereignty over priorities through country-driven agendas, equity in financing through rebalanced resource flows, accountability in delivery through joint stewardship of global instruments. We have called for, one, a dedicated Africa window in the pandemic fund co-governed with Africa, financing that strengthens Africa CDC, the Africa Medicines Agency, the Africa Humanitarian Agency, as well as the regional economic communities, but not bypass them. And then a move away from fragmented donor-driven projects toward pooled procurement investments aligned with continental strategies. As a continent, we do not seek representation for symbolism. We seek decision-making power grounded in legitimacy and systems capacity. The third reflection is on a unified ecosystem of resilient public services. We must shift, that is Africa, we must shift from vertical programs to a unified health ecosystem that connects pandemic preparedness, universal health coverage, and social protection. The Sustain initiative in Ghana embodies this shift. So does the Lusaka agenda, which champions domestic investment and integrated service delivery for HIV, TB, and primary health care. We are not building parallel efforts. I think our partners should understand that. We are not building parallel efforts. We are building a new operating system where resilience, equity, and localization are not afterthoughts, but are the founding principles for our continent. Our vision of health systems is clear. It is gender responsive, with community health workers at the center. It is digitally enabled. We heard the minister from Nigeria mentioning that. Locally manufactured and regionally coordinated. It is financed from within with support, not substitution from our partners. I want to be clear that Africa does not need more pilot projects. What we need as a continent is predictable financing, mutual accountability, and respect for regional leadership. We've heard a lot. Kwame Nkrumah, our former president, mentioned and quoted a lot today. I believe the core underlying word is unity. It's only if and when we come together, unite and speak with one voice, then Africa can make progress. Excellencies, former presidents, honorable ministers, and colleagues, we stand at a turning point as a continent. The old extractive, reactive, externally driven model has run its course. It is time for a new model, one that is African in vision, continental in scale, and global in influence. We as Africa bring to the table a clarity of Abuja, the ambition of Accra, the momentum of Lusaka, and the voices of our 55 member states that are ready to lead. I can't conclude without commending the foresight of His Excellency President John Dramani Mahama, whose leadership and hosting of this summit reminds us that sovereignty begins with vision. Also, I would like to salute President Kagame and also former President Obasanjo, the AU's lead on domestic health financing for advancing Africa's global standing and institutional resilience. Of course, we also have to honor the legacy of the late Kofi Annan, whose vision helped birth the Global Fund and affirmed Africa's power to catalyze global solidarity. I believe that what we are doing today is building on what he did, and it's evident from what has happened in the past that we can, if we are committed to it, we can succeed. I also want to acknowledge His Excellency Mahmoud Ali Yusuf, Chairperson of the African Union, for his stewardship and support in this direction. Just as we are called to action 2 decades ago to confront HIV and injustice, we are called again. This is a call to action, this time to reimagine and rebalance global health governance. Africa is not only present, it must help design, define, and deliver the future. We are ready, I believe, not just to implement change, but to lead in shaping the global health architecture of tomorrow. This is Africa's moment. Let the world meet us there. And I believe that from the experiences that we had with COVID, no country, no continent is an island. If we work together, we will all achieve what we want to. Thank you very much.
Thank you, Your Excellency, and thank you to all of the panel. We had instructions at the beginning, but I think we're modifying. So that is for the entire session, 2 more minutes? Yeah. So there's not much we can do in 2 more minutes other than to thank the panel and turn it over. I was asked to, instructed to give a summary of the panel and some key points, but we don't have time for that. So we will reimagine what the panel will look like and end here to hand it off to Magda, who will introduce the, at least that's what I was told, to who, you want me to introduce them? Okay. In the interest of time, it's my pleasure to introduce the 3 reflectants, starting with a dear friend, an extraordinary human being, Asi.
Thank you very much. In the interest of time, just 3 points. The first one is about global governance. We say, I believe there won't be any meaningful global governance if there is no local governance. Often a time in our jargon we talk about let's walk the last mile. And if indeed, the problem is in the last mile, our response, there should be a first mile of response where it happens. This is very critical because, we have facing a much bigger challenge here, which is to try to bring global health order in a world which is in disorder. And I think we need to reflect on that, ourselves. What our communities and populations are crying for. Of course, they cry for health because they cry for dignity, because they cry, simply put, for normalcy. And if they cry for normalcy, they cry for peace. And on this continent, I will not miss this opportunity to cry for peace alongside of our communities. And there will be no health governance, locally or globally, if we do not have peace on this continent. If I take the map, where we have crises, of conflict, and then climate crisis, and then health crisis, you will have a juxtaposition of all those challenges in the same settings. And it is highly likely that we find them either up there in Sudan, or in the Sahel, or in the Great Lake, and in many parts of our continent. We call for leadership. Well, leadership is all about peace. Second point, indeed leadership. Leadership is about many things, but it's about also accountability. And accountability is about delivering on the promises we make. Too many promises made, too many promises broken, and no accountability. We mentioned so many initiatives since Bandung, Alma-Ata, Abuja, Lusaka. I hope it will stop there, and then Ghana will not be, along those lines. The promises that will be made, should be delivered on. If not, we will have an erosion of, let me use this word, which I have not heard this morning, which is trust. Trust is being eroded at all levels, between those who govern us and then our citizens, between the global and the local. And we will truly have a global governance of health if trust is restored. And then we have to deliver on that second point. Third point, there will always be 3 pillars that we have to keep in mind when we have moved ahead. Science, or data, or evidence, whatever you call it. In a world today which is inundated by fake news and all kinds of misinformation that are misleading us and also misleading our leaders, back to science, back to evidence. But alongside science, you will have the politics. Politics can be part of the solution or part of the problem. We're going to make sure that we have those politics that truly will be part of the solution, and then have a leadership that will be concentrating on, while we deliver on the promise, focus on the solution that the people are facing. And then we have activism. There will be no leadership alone that will solve it. That leadership should be accompanied by active citizenship that will hold us accountable, that will hold us, to deliver on. So let's make sure that we at least, work on those 3 pillars, when we move ahead. And then finally, leadership is not only political leadership, it's a leadership at all levels, in all sectors. And it is maybe time, that we build, from this movement that we are starting today, a leadership alliance at the highest level, all the way from the president's level to champions in the private sector, to activists on the ground, as well as, community leaders. So that is maybe what is transpiring in many of the discussions, that we have, that will give, the quality of governance, of the global health architecture that we want, that is not only left, with health attaches, in big capitals, but that is led, at the appropriate level, and then bringing the different inputs of the 3 pillars that I mentioned. And I thank you.
Thank you. Thank you, Alice. And thank you for leading the legacy of Kofi Annan as chair of the board of his foundation. The next reflectant is Soji Adeyi. Soji's over here, who is the president of Resilient Health Systems.
Thank you, distinguished ladies and gentlemen. I always agree with El Haj Asi, especially on Tuesdays. My sister, Dr. Robalo, challenged us to be candid and bold. So I seek your permission to speak candidly. The fundamental question is straightforward. 5 years from now, 10 years from now, imagine that we are seated here again. What would it take for us Africans to say the following about our health system and external financing? Free at last. Free at last. Thank God Almighty, we are free at last. That is the simple question. And with that, I would like to reflect on 4 quick points within a 2-minute limit. Initially, I thought it was 2 hours, but then I realized it was 2 minutes. So the first one regarding the global health architecture is that of subsidiarity, the principle of subsidiarity. What responsibilities and functions that can be performed at the country or sub-regional or regional levels should not be performed at the global level. That's fairly straightforward. Let us use one essential function to illustrate how that should play out. And that function is financing for pooled procurement. Is there anybody in this room who believes that Africa, a continent of 1.5 billion people, 55 countries, is just congenitally incapable of organizing pooled procurement by itself? Please raise up your hands. Well, so we take it that we don't believe that pooled procurement for essential health commodities coming to Africa should take place outside the continent. Let's make that resolution number 1 coming out of Accra. So, I want to take this moment to paraphrase President Charles de Gaulle, the former president of France. You see, Africa's health sovereignty, and we've heard a lot about sovereignty today, is not just about deterring an aggressor. It is also about like the Global Fund and Gavi. They have a congenital defect in that they were set up without any sunset date. And that perpetuates dependence, needless dependence. I have been told, and I know this firsthand, despite the fact that basic equipment it needs, it will control its own destiny. This requires not only private, but also public investments in an ecosystem of research and development, industrial policy, incentives, and legal enablers. Thank you.
Thank you, Soji. I believe I'm receiving an instruction from one of our bosses, Dr. Bompo, that we are done with the session. Yes. So please join me in thanking all the panelists and reflectants for their excellent contribution.
Please give them a hand of applause, our moderators and panelists. I'm informed that we have about 80 people following us online, and there are several questions that we would have loved to bring to your attention and also answer those questions as we interact with our audience. Unfortunately, we are running out of time, and I apologize for mismanaging the agenda on behalf of those who speak for 2 hours instead of speaking for 2 minutes. We are now going to a ministerial panel, and without further ado, I would like to invite on stage the Director, Policy Planning, Monitoring and Evaluation, Belinda Nimako, and Dr. Hedem Adzojenu, co-chair of the Afro Champions Initiative. And they will be presenting on the sustained framework for safeguarding global health gains. Dr. Hedem Adzojenu. There he is. I would now leave the stage on your capable hands, but please help me with time management. And if possible, we would like to reduce the time you will be presenting. They will be introducing the moderators for this session, and then we will have our panelists. The floor is yours. You'll start, Belinda Nimako. The floor is yours. Thank you.
Thank you, Dr. Magda. So good afternoon. My task here is very simple, and that is to introduce the SUSTAIN initiative. As you would realize on your program, It was billed to be delivered by the Deputy Chief of Staff, the Honorable Nanoye Bampoado. But I guess in the spirit of sustain, she's created space for the next generation. So thank you, Madam. And I believe one of the speakers earlier talked about expired leadership, expired presenters, etc. So again, perhaps it's time, as we talked about reimagining global health architecture, to task ourselves that beyond the reimagination of financing of governance, one of the tasks is to create space for the younger and the next generation that we are seeking to create a new world order in global health for. Thank you. So I'll now deliver Madam's speech. The Sustain Initiative, Your Excellencies, ladies and gentlemen, our distinguished guests, once again, we give you a warm akwaba to Ghana and welcome you to this co-creation summit. And my task, as I mentioned earlier, is to introduce Sustain. And Sustain is an acronym. It stands for Scaling Up Sovereign Transitions and Institutional Networks for Health. I'll now tell you a little bit more about Sustain. What is Sustain? Sustain is a practical framework designed to help African countries plan, finance, and sustain our own health responses. It maps out all domestic and external health financing flows, identify gaps and bottlenecks in our systems, and builds a country-owned roadmap to mobilize domestic resources, partner with the private sector, and engage communities to secure health sovereignty. And that's a word that I'm sure by now you've become familiar with, health sovereignty. In other words, ladies and gentlemen, Sustain is a tool for sovereignty. It is a tool for resilience, and more importantly, a tool for impact. It is how we safeguard our health gains, plan responsible transitions from external support, and we've just heard suggestions around the transitions and the timing of it. It is also how we embed sustainability into national systems that serve our people for generations. Ladies and gentlemen, Sustain as we imagine it is underpinned by a number of principles. These principles include sustainability itself, private sector engagement, which we have heard about, and complementarity. The most remarkable thing is the value of Sustain goes far beyond individual countries. Sustain is a continental tool, one that Africa must adopt. Not only adopt, but adapt in the spirit of co-creation. And more importantly, a tool that we must own. But frameworks, as we've been told all this morning, matter only if we use them. We need early country adapters who would take Sustain forward and customize it to their context and demonstrate how it can drive results. When these national and sub-regional efforts come together, we expect to see an undeniable shift in Africa's health landscape, a shift that signals to the world that Africa is charting a new course, a course that makes us more self-reliant, a course that makes us more collaborative and ready to lead global health governance reforms. So today, ladies and gentlemen, on behalf of the Deputy Chief of Staff of Ghana, I invite you to adopt the Sustain framework, step up as an early adopter, and travel the journey with us. Ghana has every determination to be among the first. Together, we can all show the power of African leadership and shared action to protect our people and deliver lasting impacts. It is now my honor to invite Dr. Edem Adogonu, co-chair of the Afro Champions Initiative, to speak to us about how SUSTAIN will translate political will and continental ambition into sustainable financing and real health impact. On that note, I thank you and once again, Akwaba, to this session.
Thank you very much, Dr. Belinda and my colleagues. I'm going to ask that the slides be projected so I can quickly breeze through them. I've been told I have 5 minutes. So can everyone see the slides? Okay. So we're here to talk about sustaining hope. Sustain, we know it's an acronym, but it also speaks to how we sustain hope. Next slide, please. Next slide. In sustaining hope, we also want to, as we move on to the next slide, to also demonstrate that we need to move from 3 very strong pillars, which is very essential for how we're going to sustain hope as we scale up our transition. Of all the global development areas, health is the one that has seen the steepest fall amongst all the other areas of endeavor. We can see from the slides that over the last decade, 10 years, health has been the one with the most or the steepest fall. Next slide, please. But it seems also like the continent is being squeezed from all ends. It's not just the donor flows that are drying up, it's also borrowing costs that are going high, and also the legacy of recent crises like the pandemics also still remain. Next slide, please. So this obsession, so now that we know that we are being squeezed from all angles, the question is, what are we going to do about it? Now, we have this obsession with shortfalls and gaps and deficits that we are talking about, but we know it's also due to the fact that we are treating Africa's health as if it's a well, as if it's a bucket that is looking for support and resources, and most times from external sources from elsewhere. Next slide, please. But what if we flip the script? And what if we, instead of looking at it as a bucket looking for people to come fill, we treated it as an endless well? A well tapping into possibilities of our youth, of innovators. I still wonder why the continent with the youngest population in the world is not the source of the freshest ideas for innovation and development. But we do have those latent bounty of transformations that exist on the continent, and we need to begin to look at the way of sustaining or scaling the sustainability by tapping into the latent energies we have. Next slide, please. And move health from becoming a cost center, as we've heard said many times today, into a growth pole. In other words, creating wealth through health. Next slide. So sustain is indeed this pragmatic vision that is looking at how we're going to sustain health, create wealth through health, and transform it from a burdensome cost center to a growth pole, as I've said earlier. Next slide, please. I'm just quickly breezing through for the sake of time. So what are the strong pillars of that underpins sustain and sustainability? Governance gap that exists currently. There's so much intersectoral weaknesses and leakages that currently exist. There's no way we're going to unite a continent of 55 countries if within countries, department agencies are not integrated. So governance gap is very key. The silo gap is another one. Too many similar programs being funded by different stakeholders and donors, not aligned. And then there's private sector that's also putting corporate social responsibility, sometimes not fitting into priority areas of government. And then there's the health to wealth agenda that we spoke about. Next slide, please. Next slide. Okay, so here I'm going to lay out the 3 core and very important aspects of sustain. And my sister Belinda talked about it earlier, but I'm just going to emphasize the following. 1, the need to be able to cost all the inflows that are coming from external and internal, and I think some countries have done that work already. With a lot of money being put into health, but what are they going to? Where are they coming from? And what are they achieving? We need to have that data. Like I said, some work has been done on that already, but we need to do it comprehensively. Then two, because we are talking about all societies, all of governance, but all of society. Next slide, please. We need to take also into account, out of all the monies that we receive, how much do we actually need? How much do we really, really need? Because it could be that so much money is going to areas that we have no need for, or are not priorities. And it could also mean that resources are being invested into things that are being replicated by other donors as well, or other financiers. And there could be some things that private sector will be doing. I think if we use the right data models to determine what we actually need, we might find out that actually the gap that has been created is not several billions, it's probably just maybe 1 billion. So that work needs to be done. Once we understand that, then we move to the step 3, which determines how much can we actually fund on our own. And this is where we are able to reach out to mechanisms. I talk about CSR programs that could be coordinated better, but we also talk about also investments that will come into areas that private sector, a lot of capital sits in private sector. But most of that resources is not coming into areas of health. In the US, health contributes to the economy through pharma, through clinical research, among others. But yes, in Africa, we are so dependent on aid. And then the last area is to now look at how we link. Now that we know the gaps that are created for real, not the abstract sense of gaps that we created, but now we know the gaps, and we know how much we can fund on our own, then we can now move to multinationals and multilaterals and other partners to tell them where we think we need help and where we need partnership. So those are really the core elements of sustain. Next slide, please, and I believe is the final slide. As I see that I'm being shown 1 minute left. So as we take this high-level takeoff, we're looking at the coordination between private sector, government. That's why we talked about the all-of-government approach. And that's why in Ghana, we've seen leadership already at the level of presidency driving sustain, with all the ministries interconnected. Then the first week is doing this assessment. The first few weeks is to start with these assessments. The next few weeks to months looks at also identifying the gaps, and they're looking at what we can fund on ourselves. Next and final slide. So as we move on to redeem the dream of sustaining these hopes, we believe that the core thing is to deepen and leverage institutions and resources like health insurance in our countries. We need to weave technology. We need to weave digital natives. We need to weave government programs into the private sector networks where entrepreneurial abilities exist. We need to also attract biotech investments. So much money exists in places like China, the US, looking for cell sites to do clinical trials that we are not even attracting. And finally, we need to crowd in. We need to crowd in medical research. We need to crowd in hubs. We need to crowd in other areas that don't necessarily operate in health, but yet money flows through them, like fintechs and among others. We believe that if we do that, the hope of moving from sustaining the gains that have been made by the old world order and scaling transition into a sustainable, self-reliant and self-sufficient model will be achieved. Once again, thank you very much.
Thank you very much, Dr. Adam and the Director of PPME, Minister of Health, for introducing the SUSTAIN framework to us. It is now my great pleasure to invite the Honorable Michel Sidibé, former Minister of Health from Mali, and the Honorable Dr. Victor Vampo, CEO of National Health Insurance Authority of Ghana, for this final ministerial roundtable and session where they will share with us some insights in a shorter time than initially anticipated. They will then go into conversations with the Deputy Minister of Finance from the Republic of Ghana, Honorable Thomas Hampen, please join us on stage. I would also like to invite Professor Claude Muvigny, Director of Biomedical Research Center from Rwanda. And we have two other ministers online. We have the Honorable Dr. Austin Dembi, Minister of Health of the Republic of Sierra Leone, who will share his reflections with us online, and Honorable Dr. Teodoro Herbosa, Secretary of Health from the Republic of the Philippines, also online. Honorable Michel CDB, the floor is yours.
Thank you very much. I am very embarrassed, I can say. I feel even being ambushed because this important session should have been planned certainly after the lunch. When I saw this paper being distributed, I said, now I'm just between you and this paper and your lunch. But Excellencies, sorry to just start like that. The issue is so important, as you all know. It is a great honor to co-moderate this Ministerial Roundtable at such a critical moment. Thank you, thank you, thank you. In our continent, we are, like we had since this morning, we are in a period of profound, I can say, the transition. The foundations of global health governance are shifting. Multilateralism is under pressure. We heard that. Donor funding is flattening. And our health system are under enormous stress. This is not a theory. It is what ministers, health care workers, and communities live every single day. Too little fiscal space, we have. Too many parallel systems. Too few chances to lead our own agenda. And I can tell you, when I serve as a Minister of Health, after working at the grassroots level as Under-Secretary General of United Nations, I can tell you, as a number 2 of the government in Mali, I had just $40 per person per year to deliver on health. I didn't control most of what came from partners and how it was used. Most systems and processes we work with were fragmented and not truly ours. Many of you, I am sure I heard my young brother from Pierre face the same situation today. That is why the Accra initiative matters. And that is why we are here to bring to life one of its most strategic instruments, the Sustain Framework, which has been already presented to you. This is not just another declaration you have. It is a practical tool created by and for African leaders. It helps us all navigate uncertainties, preserve gains made, and build the systems that are resilient, sovereign, and future-ready. Let me pause to acknowledge Ghana's leadership. From Mahama Care to President Mahama's decision to advance a national fund when donor support was delayed, Ghana made health sovereignty a deliberate political choice. So today, I invite you, our ministers and leaders at all levels, to reflect not just on challenges, but on opportunities and bold action. Let me ask, in this challenging environment, what concrete steps are your country and sectors taking to transition from aid dependency and build a nationally owned, sustainably financed, and resilient health systems? And how can the sustained framework support you in that journey? Excellencies, it is now my honor to invite you, my young brother, Deputy Minister of Finance of Ghana, to share your reflection. We heard your president today, our president, in the opening ceremony, saying that health is not just a cost, it's not just an expenditure, it is an investment to transform our economy. So could you just share your reflection after listening to him and calling on you? Thank you.
Thank you very much. Let me say that because of time, I'll skip all the pleasantries and make a brief statement on behalf of the Finance Minister. I've just been alerted that I have 5 minutes. To be honest with you, when I saw the list of the panelists, I asked myself, what am I doing here? Because I'm the odd one. Everybody is either a health minister, a former health minister, CEO of health insurance, and others. But then it is quite obvious why you need a finance minister in such an important discussion. And as I sat there listening to the wonderful contributions by earlier speakers, I asked myself, how can we in Africa achieve health sovereignty? And I will say boldly that we cannot achieve health sovereignty if we don't first achieve financial sovereignty. Because all the wonderful ideas we have, all the initiatives must be funded. And so we need to have financial sovereignty to be able to achieve health sovereignty as a continent. And in your introductory statement, you made an important point about aid dwindling. We cannot continue to depend on aid to achieve health sovereignty. We have to plan as though there is no external support coming to us. In fact, aid has never been intended to be a permanent feature of our health financing. We saw this coming. We have seen a number of our donors reducing their support to us anyway. And so a day like this will come. A day will come when the donor supports will dwindle to zero. And so what do we do to be able to bridge the gap? And from where I sit in the Ministry of Finance, I totally align with the statement made by my president. And we agree with the famous statement that health professionals always make, that a 1% investment in life, extension in life expectancy will lead to a potential 4% increase in GDP. For us, anything that has a direct positive link to GDP excites us. And so we see investment in health as investment to enhance the productive capacity in our country. And that is why we have done a lot of investments in this. But Africa must take note. Today, IMF says that about 20% of our revenue in 2024 was used to pay interest on our loans. So we are spending, 48 countries in Africa are spending more on servicing our debt than on health needs. That is scary. So as long as we continue on this trajectory, as long as we do not take a break and rethink our finances and manage our economies in such a way that we will reduce debt on our economy, it will constrain our ability to provide funding for essential sectors as health. Look, as a Minister of Finance, you meet health professionals They will give you all the wonderful reasons why you must allocate more of the national resources to the sector. 5 minutes after you meet the education professionals, they will also tell you all the good reasons why 100% of your revenue must go into supporting education. The energy minister and his officials will also tell you that without energy, all the health initiatives cannot even work. Our health institutions cannot work. So we have competing needs for the meager resources. That is why I was excited by statements by Dr. Edem and others who are advising that we need to really look at what we are spending on. If there are duplications, we must remove them. We must make sure that we utilize the resources optimally and get more from little resources. That is key. In Ghana, a lot of things have happened. In fact, at the time that the USAID funding was cut, was the time we were preparing our budget because of our transition. And I recall the president called the finance minister and gave him strict instructions that look for money and make up for the funding gap. And so internally, we have increased. How
do you think the sustained framework will be helpful for you?
It will be very, very helpful because without the sustained framework, how do we ensure that we have adequate funding to support all the initiatives? It is very key. And as I said, we cannot continue to depend on external resources. We need to look for the funds within. And so Africa today, our tax to GDP ratio hovers around 16%, as against 34% and higher for advanced countries. How do we implement this sustained framework if we cannot generate enough resources within? And so we must strive to increase, to raise more revenue internally. Look, I have said this several times. In the United Kingdom, their tax gap is only 5%. Still, the HMRC is striving, being innovative to further reduce the tax gap. In Ghana, our VAT gap is 61%. What that means is that we are collecting only 39% of our potential VAT revenue. There is a huge gap. And so we need to strive to increase all those collections. If we are able to collect more revenue, the 15% of revenue that we committed to in Abuja may be enough to finance a lot of our health needs. But if we don't increase the revenue, even 50% may not be enough to sustain all the initiatives that we have. I understand my time is up, so thank you.
Thank you very much. Thank you. Can I, you have, because I'm not seeing other panelists. So, Claude, I am so happy, Professor, to see you here. And I don't need to really spend time explaining what you're doing in Rwanda. You're considered as a success story for most of us. And for a long time, the sustained concept was already something you were adopting. It is without calling sustain. But if I want to ask you a simple question, like, for example, what could be the 3 or 4 main areas where you think we should take action to make sure that we transition from AIDS dependency to more sustainable approach financing our health in our continent? From your own experience, from the experience of your country, what could be those 1 or 2 or 3 really key action we need to take? I want to be practical.
Thank you very much, Honorable Michel Sidibe. First of all, I would like to thank the government of Ghana and also His Excellency, the President, for inviting us to really discuss on this sustain, which I think is very good initiatives that Rwanda support and stands to contribute to make sure that we all support these initiatives. I think also being the director of National Public Institute, it's also a privilege for me to be in these very high panels of ministers, which I think is a very opportunity to also continue to discuss on some of the challenges which are now putting us in the risk of going back to where we could not control some of the diseases like HIV, TB, malaria. And also, it's also another threat for us as we are now being challenged by the current funding cuts, but also declining. Again, we know that in the during the 2 decades, through the investment that we've made in Africa, we've been able to also reduce maternal and neonatal mortality, and we have also been able to expand vaccination coverage due to partnership that we've received through the partners, but also continue to control those diseases that I mentioned. So if you reflect on this morning discussion, but also on how Sustain is really an initiative that's come at the right time, which I think is going to really support us as we are dealing with those issues. And without forgetting also the impact of COVID-19, but also other emergencies that we are now being facing in our regions. First, I think it's very important to continue to ensure that countries put much effort in some of the domestic financing, which I think we need to have that ownership, which begins at home, where, for example, in Rwanda, the community-based health insurance today is able to cover 90% of the populations. And this model is really confirmed by citizens, the government, the private sector, and also we see some substantial pro-poor subsidies that leave no one behind. Again, there's also another opportunity, another reflection that I want to share, where through the performance-based financing, which I think is a clear evidence to the Minister of Finance, for example, that really link how we allocate resources to the results, but also ensure we continue to have efficiency and also accountability and also a way of improving health outcome. Again, as was said in this morning, we need to continue to build a resilient system, which I think is one of the way we be able to have capacity to endure, but also to adapt our systems. And for example, if I want to reflect on Rwanda experiences, for example, where we continue to really put much effort in community health workers, where we are continuing to professionalize them, where those community health workers are essential to really continue to assure that we have those health services closer to the community, and also we continue to support and empower them in the sense that they have all the tools, like digital tools, to allow them to do their work. And also, at the same time, if you want to have this system, we need probably to continue to build a strong surveillance system and also some early warning system to be able to prevent us to those threats. Again, this morning also we mentioned about how do we have to continue to really invest in our primary care, where we need to have a very skilled personnel and also system like laboratories and also the centralized services that are able to ensure that we are ready for any threats. Second, there's also the issue of equity and universal care, where we continue to rely or leverage on community-based health insurances to ensure these services are access to everyone. Again, accountability is another problem, another focus also, where we want probably to make sure that as we continue to support this sustain, how do we use data for people? The data that we're mentioning here is where we need to ensure that there is accountability from the local government and also national programs where we use data and also citizen feedback and also those performance contracts that I mentioned to guide our improvement of health and also allocate resources to our needs. I think this is something as head of national health programs, we've been able to really make sure that we revisit our programming where we have to make sure that there's efficiency in really interventions which are probably have shown that has worked very well in the past. How do we continue to make them sustainable in the sense that we have the right interventions because of these scarce resources, and also continuing to also rely on African partnership to continue to learn from each of our countries and then probably continue to be supportive of this sustainable. Thank you very much for this. And lastly, I think Rwanda government welcomed this sustained framework as it's also aligned with the efforts that His Excellency, the President of Rwanda, Paul Kagame, is leading in terms of really making sure that we have this very strong domestic financing system coming to really support very strong institutions, but also community-based approaches and also needs that we want to really probably to continue to put as at front of anything that we want to plan as intervention. Thank you very much.
Thank you, Professor. I'm very happy to hear you talking about a practical programmatic approach which are owned by Rwanda, which is really bringing efficiency, which is reducing unit costs, which is helping us to go to the people, majority of the people, with the services which are needed. So I think it's very important to keep that in our mind as a part of a sustained framework, how we can safeguard not only the health gains, but how we can also scale up what we have been already doing. Thank you very much for sharing this experience. So I want to turn to you, Victor. I think I am so used to you, but I'm happy to see you sitting in this position and leading a very important portfolio of your country. And just please take over.
Thank you. Thank you very much, Michelle. And pleased to be here as well. Welcome to everybody. We keep it going quickly. I think we have Honorable Minister of Health, Austin Dembi, on the line from Sierra Leone. And the question to you, sir, is, you've heard about this sustained model. You are in Sierra Leone. How do you think this can aid you going forward to achieve governance and sovereignty in health? Over to you.
It's a little difficult on our side, but I want to thank the organizers. I'm so sorry I couldn't be there in person, but I'm there in spirit. I think for us in Sierra Leone, we see just the global health architecture as critically important, and the changes that are going on, the kind of headwinds we're meeting out there are not a crisis situation. We see it as a real opportunity for lasting change. The background to this is that we've been receiving a lot of assistance. Some of the assistance is directed at areas that are not national priorities. We have very disease-focused silos that have been going on, and some of them have gained us some results. But at the end of the day, the health care of the nation is not in silos. People's health are not in silos. So the delivery of health care should clearly not be in silos. And I think for us, we're shifting focus. We're looking at patient or client-centered care and looking at the life stages approach that's a comprehensive view of everybody's health from pregnancy to senior citizens. And the approach to this is ensuring that We don't want to have the best malaria program with all of the box ticked with bed nets and vaccines and insecticides, and somebody has typhoid or they have malnutrition, and we lose that person. If we do, we've lost all of the investment in malaria. So again, I think we're looking at a comprehensive person-centered care, and it's following the life stages approach. In terms of financing, the country spends about 11% of expenditure, government expenditure on health, but it's 11% of what? I think we need to grow the economy and allow that 11% to be a lot more meaningful. But we're looking at some innovative approaches that's looking at revisiting health financing, looking at loan swaps. We're looking at opportunities for health insurance. We're looking at sin taxes. We're looking at a very active engagement of the private sector as additional resources into the sector. We're looking at just ways of addressing things and having a strong digital approach to it, ensuring that data is actually driving our priorities and engaging in things that look at health outcomes rather than just processes. I think for us, we have four major framing issues that help us with our engagement. The per capita health expenditure is still about $46 per capita. But again, we want this $46 to mean something. And if we have additional assistance from partners, we want it to fall within our overall framework. We have what we're calling the 4 A's. One is A for accompaniment. We have a clear vision of where we want to go. We have a clear vision of what the activities are that will lead us to accomplishing those goals. And so we want our partners to accompany us on this journey. Accompaniment means believing in that vision, in working with us to accomplish the vision. The second is alignment, ensuring that the partners are not moving in conflicting directions, that we're all moving in the same directions around a common vision. The third is mutual accountability, ensuring that we are accountable to the people, the promises that we make have been fulfilled. And if our partners come in, we know they are accountable to their taxpayers, but also be accountable to us in the deployment of these resources for the best health outcomes. The fourth force is an accelerated pace. We're in a hurry. We're in a hurry because every delay means a woman dies, a baby dies, and we're having a major price we're paying for all of these delays in the system. So there's an urgency in our action. And I think the kinds of dramatic gains that we've seen with the 76% drop in maternal mortality in the country, with most of that happening in the last few years, with the dramatic drop in infant mortality, with the dramatic increase in vaccination coverage, shows that we're moving in the right direction. And we'll ask our partners to be completely aligned with us, accompany us, and then work on an accelerated pace and be mutually accountable. Thank you.
Thank you so much. I think that was very, very clear and very succinct. And moving on quickly, I remember you said that we're standing between colleagues and lunch. So I wanted to invite Tom Frieden. Tom, we'll give you a couple of minutes because I know you have something very important to say. And for those who don't know, Tom Frieden is a physician and former commissioner of the New York City Department of Health and Mental Health. So Tom, you've heard this morning from Accra about African health sovereignty. And we're talking specifically about sustain. Your comments, sir.
Thank you, and sorry I couldn't be there in person. I'm deeply honored to have this moment to speak with you. I will not take much time to hold you from lunch. I do want to share with you some of the lessons that we have learned with African countries. We have offices in several countries on the continent, and we're honored to be partners with many of the governments and many of the individuals here. I want to first talk about health taxes. It's been a theme of this conversation. There are myths and realities, and we see these as we learn with countries around the world. One, health taxes don't cause smuggling. The malfeasance of international, multinational corporations, along with weak governance, causes smuggling. Two, health taxes are not anti-poor, especially if the revenues are used for pro-poor interventions. They are starkly pro-poor. 3, sugary drinks are not inexpensive calories that benefit the poor. They are empty calories devoid of nutritional value that harm the poor. 4, alcohol is not a harmless pastime. Alcohol is underlying many of the not only health, but also social, economic, and interpersonal and infectious disease and cancer problems that countries face. Now the realities of health taxes. Tax administration is important, it's hard, and it's important to counter the growing anti-tax sentiment. Tax transparency can also counter that anti-tax sentiment. The revenues are real. Increased health taxes will increase revenues, but they're not sufficient. They're not going to fill the gaps. What they will do is counter an extraction of the value and health from countries that is then used by multinational tobacco, alcohol, junk food, and sugary drink companies. To counter that extraction that offloads the health costs, the economic costs, the interpersonal costs, and the social costs of these unhealthy products onto African governments and African communities, and counters that by reclaiming that value for the countries themselves. I also want to just end with one comment on primary health care, which has to be the route to progress. I'm so impressed with so many of the commitments, statements, and more importantly, actions today. President Mahama's comment that health is our greatest public good is deeply inspiring. Primary care is essential, but we have to be open and say that around the world, every country, there are very few that have shown real progress because of insufficient funding, insufficient structure of funding, insufficient prioritization. Prioritization is really hard because when you prioritize one thing, you deprioritize something else, and that's never easy. But in truth, if we looked at the list of 300 essential medicines, we could probably choose 30 that are truly indispensable, very high impact, and that should be available at very low cost, possibly funded by health taxes or by partnerships or by industries that really do want to contribute. Prioritization is a country decision. The role of partners such as ourselves is simply to support that decision, to hope that it is based on ground realities, not theories, but ground realities of what's actually harming, hurting, and killing people. Hope that the decisions is based on maximum impact, addressing the leading causes of death. Hope that it's based on an accountability for progress. Hope that there's recognition that digital technologies are a tool, not an end in themselves. That they can be transformative, but they're hard. They're not inexpensive. But between large language models, AI, and telemedicine, they do have transformational potential. That we could go from a situation right now, we've heard President Mahama mention hypertension. Currently, less than 0.1% of all global health dollars go for hypertension, and yet it is Africa's leading cause of death. It kills more people than all infectious diseases combined. It can be treated for $5 a year or less. And if we focus on the number and proportion of people who get effective medications to treat their hypertension, we could increase that number from the current level, which is in the low single digits in most countries in Africa, to much, much higher, tenfold higher. So I'm honored to be here. I respect everything you're doing, and I'll follow with great interest, respect, and partnership in any way we can. Thank you very much for inviting me.
Thank you very much, Tom. That was awesome. Michelle, we have two things we have to do now. One, I am required to summarize what these wonderful people have said. I will not do that, especially because sitting next to me is a supervising minister, and if I say the wrong thing, he may not give money to the National Health Insurance Authority, so I will not do that. But secondly, and more importantly, I just wanted to share 3 points before we hand over to Magda to take it up. 3 things I was jotting down and I wanted to share with you. It's about Ghana's road to sovereignty, health sovereignty. The first one was, show me the money. So the president was talking about how the was uncapping of the National Health Insurance Fund because the previous government had put a cap on it. It meant that when he removed the cap, and that was one of the first things he did, we had an extra 3.5 billion cedis, which translates into about $350 million. So there was more money. The second one is put your money where your mouth is. And what do I mean by that? Prioritization. So we are being given the funds, using the funds to plug the gaps that were exposed by the stop work order, using the funds to buy vaccines and to do other essential things in the health sector. And we have been made aware by the Ministry of Finance and the Comptroller and Accountant General that health is a priority for the President, for the Minister of Finance, for the Minister of Health. And the third is success has many fathers and failure is an orphan. Because we are able to have a lot more funding to do what we have to do, there are lots of success stories to share. But then there's also a lot of accountability. So my brother sitting next to me calls me once every week and he says, Victor, are you sure that the money that we're giving you, you're using for the right purpose? Because we know that if we misapply or use it for something else, we will not get the money. So there's that bit about accountability as well. But the point is that we are driving more efficient use of the resources. So it's both about the quantum of the resources, but it's also about efficient use of the resources. And I think Sustain will be a great model to help us on that journey. With that, I thank you very much. Over to you, Magda.
Please give them a big round of applause. Honorable Michelle Sidibe and Honorable Victor Bampo, Deputy Minister of Health and the Director of the Institute in Rwanda. Thank you very much. They were not standing between you and lunch. I'm standing between you and lunch. Thank you very much. And I'm going to tell you two things. Listen to the first, don't move, and then listen to the last. That's the most important. The first thing I want to tell you is that please, I thought you wanted to say something. No, Juvati? No. Thank you, sorry. My first point is that when we go for lunch, we want you to use the time of your lunch to continue this dialogue in an informal manner. The dining area is organized in such a way that we have tables for 5 thematic areas with multiple tables per team. The first team is African leadership. The second is health financing. The third, resilient institutions. The fourth, accountability and partnerships. And the fifth is manufacturing and technology in reimagined global health governance architecture. So grab whoever you feel you would like to have the conversations on these issues with and sit on the same table. Now, the last thing but most importantly, we have been listening to great panelists, experts, global leaders, and ministers, deputy ministers. We heard from our president. So I'm going to open the floor for 2 questions, one from this side, one from that side, just to give you the opportunity to interact and then ask any questions if you might want to interrogate some of the assumptions and the great insights that were shared here. So there is a roving mic, and I would like to see one hand from this side and then from this other side. Thank you.
She's here. She's the only one from Kenya government.
Sorry, I'll be with you in a minute. I was hoping that you will be a respondent, Honorable Minister. Thank you. Someone who has not yet spoken, who has not yet taken the floor. Yes, I see two hands from this side, then. I only have time for two. Do we have a microphone this side, please? Yes, please. Go ahead, briefly.
Friends of Osikobia.
Tell us your name.
From the coalition of NGOs, Greater Accra Coalition of NGOs in health. I know this event, high-profile event, but it's about health, and health concerns everybody. Whether you have money or don't have money, you are poor, you are the top, or you are the down. So my question is, this event, some of us couldn't get in early because of technicalities. How can we get the information to the grassroots, to the people who cannot get to this room to listen to such a beautiful information from our president, from the high-profile people? Because since I've been here since morning, but I just got in because of challenges that I'm facing. Thank you.
Thank you. Thank you very much. Honorable Deputy Chief of Staff will let us know how do we get the information to the communities. Yes, please.
Yeah, thank you for the opportunity. Reverend Agbomo Aheto, Achievers International Award. I want to ask a question as you give that opportunity. Looking at the beautiful herbal, or let me say natural medication we have in Africa, what are we looking at in terms of shifting from the orthodox medicine and putting a lot of financing with focus not on orthodox medicine but growing the indigenes who are into herbal medicine that is proving results in the hinterlands, but they do not have scientific knowledge to be able to shape their idea so that they can produce, medicine which is produced from the herbal direction. So financing is from that direction, looking at global, local strengthening of medication than the orthodox one. What is the future and what is the vision for that? Thank you very much. That's my question.
Thank you. Thank you for that reflection. I think it was more a comment than a question. Thank you so much. Honorable Deputy Chief of Staff. Okay, then final question there. Yes. Microphone.
Communication plan. This is being broadcast live, and we are going to communicate to all Ghanaians, not only to Ghanaians, to the rest of Africa and to the rest of the world, because this is a very critical issue for us. Thank you.
Thank you. Yes, final question.
Thank you, Bright Morgan. This is a reflection. I think I was a health and safety inspector in the United Kingdom. During my work, I made interviews with directors, making sure that they adhere to their protocols at workplace, protecting their staff. One of the main sovereignties or reflection we can contribute towards Africa's health, in essence, very common sense. We need to learn from people who are already advancing in their health sectors.
Thank you.
One, sorry, do I have that short time? Sorry, 1 more minute. In the advanced countries, they have designed the user patterns of where somebody who sees himself in a community, when he finds himself very ill, where does he go? He goes to the nearest GP, the doctor, which is not very far away from his community. If the GP cannot handle the deficiencies brought to him, where does it go? It goes to the higher hierarchy clinic. If the clinicians cannot deal with it, where does it go? It goes to the bigger clinic. And then we have the health centers which are connected to these GPs, the clinics, and the smaller doctors. This is just common sense. We have been discussing this for years.
Thank you. Dr. Adam
We should know
told
better.
us-
Thank you.
Thank you. Thank you very much. We heard from Dr. Adam that there are going to be consultations, and we have some weeks before we can finalize what the roadmap is going to look like, and I would like to really invite you to join those conversations. To really close us today, I would like to call upon Dr. Lois Rono, the health advisor from the Executive Office of the President of Kenya, to give us final reflections, and then we go for lunch. Thank you, Madam.
Good afternoon to your Excellencies and Honorable Ministers and all distinguished delegates today. I'll be so brief. I know it's lunchtime, and this point in time, I'm not the plate. But yes, I would like to share something small on the reflection of sustain in relation to what we are doing in our country, Kenya. The sustain initiative is such an important thing, it's such an important initiative that all of us as a continent, each country, we need to embrace so that we are able to deliver healthcare to our people. We are able to give the best with the little or the more that we have. In Kenya, allow me to just give a small snapshot of what we have done. We have embarked on delivering UHC with the leadership of His Excellency the President, and we are excited. As a population, the people are happy because we have 4 pillars, and these pillars, we have taken it down to the community level. In our pillars, we have health commodity security as key pillar, the information management ecosystem, HR, and health financing. And with the HR, we have 100,000 community health promoters. We now take the health to the people, to the doorstep. We have 100 households, with each being manned by a community health promoter, with the digitized tool and equipped with kits to be able to take screening efforts, screening for diabetes, screening for hypertension, check on nutritional status, and also monitor any maternal, any expectant mothers in our community and under 5 year children. So in our synopsis, in what we have done as a country with our healthcare financing is to analyze what we have, what are our inflows, what is the cost of our healthcare. We did that analysis and found out that about approximately $4 billion USD is what we spend on healthcare. It's huge. Out of this, a whopping $1.2 billion US is out-of-pocket expenditure, and this has driven many people to poverty, catastrophic poverty due to illness. They have to sell land, they have to sell whatever they have, and therefore His Excellency the President decided, what shall we do? After doing our comprehensive assessment, our comprehensive costs, after mapping and seeing what do we get from the donor community, from our development partners, what do we have internally, then we came up with a structure to be able to reach and to do more with what we have, and therefore we did a comprehensive referral mechanism where what we have done as a country is to segment the primary healthcare, the secondary, and the tertiary. And for the primary, it is fully funded by the government, which was not there before. And the critical illness fund, fully funded by the government. Then, somewhere in the middle where we have now the social health insurance, we made sure that each Kenyan contributes to that so that we are able to finance our own healthcare system with the help of our partners, but it is government-led. And this has been done as a whole government approach, and we have seen paradigm shifts. 4 paradigm shifts, key paradigm shifts in our country today. We have moved from a curative approach and we have gone to preventive and promotive. And with this, we are actualizing the theory that with preventing, we use $1 for prevention, will save $9 in curative. We have invested in preventive. Our president ascended to law 5 acts of parliament to enable universal health coverage in our country. And we have also changed from a vertical service system to a comprehensive integrated service. We have fragmented our